How are you? How are I? Mom, Mom, Mom told me that everything is gonna be okay, that we will stand up to it. How can I believe her? The doctor. The doctor told me that everything goes according to the plan. It's gonna be fine. How can I believe that? All of that. Everything is gonna be okay. Nothing happened. Everything is gonna be okay. Everything is gonna be okay. Everything is gonna be okay. I can't hear you. I'm losing the connection. How are you? Better. Better. But am I living my best life? Or is this life better? In the libraries they told me about mental health. What's in the news? I promised. Well, let's guess. Let's. The light? There is no light. The light is here. There is no light. The light is switched off, switched off, switch on, switched on, switched off, switched on, switched off, switched on, switched off, switched will be, and there will be the light and the electricity. There will be the light. Oh, I'm so sorry. How are you? I don't know. My doctor asked me about my strong points. What a nonsense. Where are they? I don't know. Oops. Hello. I'm so sorry. Well, I know I didn't switch on my car lights. Do you see what I'm saying? Like, lately I keep on forgetting everything. I can't keep everything in my head. Do you see what I mean? I'm so sorry. Thank you. How are you? Well, how can I put it? If somebody asked me at work, I would probably say, but you know, they came, conducted the training, and told me, now you know what it's like. But I have no idea. I do not feel that. Where are you? Where are you? You were online 5 minutes ago, and now you're not here. Can you hear me? You were online 5 minutes ago. Are you still there? I am online. We are all the network. You are the network. I am the network. We are all the network. We are all online. It's easier this way. How are you? It's hard to say. It's difficult. But it seems like I'm coming back. I'm coming back. And the doctor told me I'm fine. I'm doing great. And I'm coming back. I'm coming back. And in the train they told me we have to keep going, going, going. And I'm coming back. Oops. Coming back. Whoa. I'm back. Now, it's me again. I am my old me. And you? And how are you? better. Ladies and gentlemen, let's applaud to the Kiev Chamber Theatre named Malanka with a metaphor of our present times when mental health is becoming a conscious part of everyone's life. Well, good morning, ladies and gentlemen. Thank you. Thank you, first of all, that you are here today with us. You take care of your own mental health and the mental health of all Ukrainians. You know, it's been proved that applause also helps mental health, so let's applaud each other. So I declare the second Mental Health Forum, Human Resilience, System Resilience, open. Well, I could say that if that was an event for the formal reporting. But today, tomorrow, and the day after tomorrow at this forum, none of the 3 days will be about reporting. So it's not going to be the old reporting, because here we really have everyone who belongs, and they are all the representatives of the ecosystem of the all Ukrainian mental health program. How are you? The government, international and national partners and friends of the program, like-minded people. And you know it, when all of us are here, we simply can talk about what worked well and didn't work well. So I invite you to have this very frank and honest conversation throughout all 3 days. No reporting, only honest and frank communication with each other. But of course, a few organizational points. I think you understand that the forum is taking place on the -1st floor. It is already the bomb shelter, but of course, in case of an air raid siren, if you feel the need, you can also go -1 floor down to a more serious shelter. The workers of the hotel will show you the road, and you can also look at the indicators in the corridors. And after the air raid siren finishes, come back here. Those who are online with us, stay tuned, of course, if you watch online broadcast from a safe place. And then again, for our safety, we kindly ask you not to post any pictures or videos today, and do not put the location until 3 p.m. Agreed? After 3 p.m., feel free to share with the whole world your pictures, insights, and thoughts that you received today. And of course, in the beginning of our meeting, we want to express gratitude to our defenders, those who right now are at the front line, who are the symbol of brevity and resilience. Thank you to those who are alive, and we honor those who were injured and demobilized. So, a moment of silence to commemorate those who died. Thank you. So briefly about the program of this forum. Today we will speak about how the initiative of First Lady creates a big system. It's not rebuilding or updating of the existing system. We didn't have this system before, so this is the unique way of our country, because we're speaking about the preservation and recovery of human capital. During the second day, there will be a chance to join the sections work from the mental health organizations in the services of trauma-sensitive approach and peer-to-peer discussions on supervisions and national consultations on the draft law on mental health. So please join these discussions tomorrow, and day 3 is the exhibition of the best practices from service providers from all the regions of Ukraine. So strengthen your own networks and, of course, build new contacts. I am absolutely sure that it will be very important and useful for all of you. Let me remind you that the format of this forum is hybrid. We are in person, offline here, but hundreds of participants are joined online. And today, speaking about mental health as a separate category is not possible, because health can be only a wholesome definition. We shouldn't divide health into physical, mental, and social. This is exactly the approach of all Ukrainian mental health program. How are you? And that's what the big changes start from. They start from the idea, leadership, energy, and the initiator of all Ukrainian mental health program. How are you? First Lady of Ukraine, Olena Zelenska. The floor is yours. Thank you. After such performance, which we've just watched and felt, I want to take a moment of silence to think, but we need to keep on speaking. And I am glad to have this opportunity at the beginning of this event to address all of you, all the participants of the forum today, and to tell you that I'm so glad to welcome such big family of How Are You, which is getting bigger and bigger. Also, let's greet and welcome those who joined us online. First of all, that's the Veteran Forum in Lviv, our veteran defenders and their families. And it's great that it's happening in the way that all of us get together. All Ukrainian mental health program was conceived as an effective mutual support, and that's why we try to follow this principle all the time. And the fact that the How Are You community is getting bigger, it means that there is more support, and that mental health is becoming more important for the whole country, that the country realizes that this is a part of our resilience. So, all Ukrainian mental health program, How Are You, is developing. And on the one hand, all the time we're learning. And this is what Ukrainian specialists have been doing this year, visiting countries where the mental health programs could be working for many years, and our specialists could learn something. And in each of these countries, our specialists were learning the best practices. For example, the elements of coordination, we borrowed them from Belgium, where this coordination operates, exists both vertically and horizontally. The concept of mental health centers was in the United States and Italy, which have the very successful experience of mental health care. Then training of specialists for specialized care, especially children's specialists. We learned that from the UK. Specialized care for people with combat experience. We learned that from the US and Canada. Now, the services on the community level, especially for children and adolescents in Denmark, a system of mental health support during rehabilitation in Sweden, and a culture of discipline, peer-to-peer approach when someone with similar experience works with the person. We learned that from the US. At the same time, we're creating, based on that, our own unique experience, because our challenge is unlike any other challenges. The program has to protect the psyche of our people during the terrible aggression against our country, and the program should both support and, when necessary, unfortunately, treat fresh wounds. Even during last year's forum, I heard from our foreign participants, and it was very nice to hear that they said, I will tell everyone back home what we can learn from Ukrainians. That is a very high esteem. And I think that over this year, our experience increased by many times. And only you, those who directly create our program, you know how to help the patient, for example, when the specialist is in the same extreme conditions, under attacks and constant stress, uncertainty. So, how we can create mental health service where it used to be like impossible, or it seemed impossible or irrelevant, for example, in the museum, palace of culture, sports section, or the center of administrative services? Or how can we turn any joint action to community activity, from volunteering to hobbies? And day in day, how can we break the ice of prejudice in the society where it was not okay to complain for many years, where your heartache was something that you had to keep to yourself? So the Ukrainian society is learning and will continue to learn not only how to overcome stress, but how to live with and coexist with different experiences. Unfortunately, our experience has one more sign. It is often traumatic. Increased trauma sensitivity is now about all of us. It's about the whole society, about a doctor, about a random traveler, the service worker, the neighbor, or your family member. All of us together, each word and each action towards each other is also mental health program. So around the changes that are aimed at the person and person's well-being, over this time, we've managed to build the whole ecosystem. It's the synergy where everyone is a partner, the government, non-government sector, experts, scientific community, who take a step together. So Timur said there will be no reports, but let me say a few words about the results. More than 375,000 Ukrainians received mental health support at the primary healthcare level this year from their family doctor, therapist, or pediatrician. Yes, this number is not very impressive, but it's 3 times more than last year, and the most common complaints are anxiety, sleep problems, and depressed mood. More than 108,000 specialists in various sectors are ready to work with such conditions because they had the training under the WHO MHGAP program. 209,000 teachers have been trained to help and to be able to recognize students' different conditions. 185 resilience centers operate in different regions of Ukraine. 89% of personnel of the Ministry of Internal Affairs have been trained on psychological first aid, and almost 19,000 trainings were conducted in the regions in various areas over the course of the year. Self-help, interaction with people with combat experience, stress management, problem management, and so on. So we can say that more than 1,700 trainers were trained. And I'm also very happy because we demonstrate our results at the global level. Recently in Geneva, where the report of the Lancet Commission on Mental Health in Ukraine was presented. That's honestly, and the 77th World Health Assembly adopted a resolution on mental health initiated by Ukraine and the Netherlands together with the support and co-authorship of 27 WHO member states. Yes, Ukraine knows what it's building. Ukraine is moving in unison with the main global developments and has strong expert support, and I am grateful to everyone who helps us with that. I want to say once again that we do not wish anyone to go through the experience we're going through, but we are ready to share our best practices to make life easier all over the world. Dear friends, right now here in this room, you can see each other with the help of video link, and it's great and it's important to see everyone who works in this field, even when you have no chance to meet in person. A mental health care network is strong when everyone in the community knows about each other, and when there are established roads of interaction. Then the person will not get lost, and the person will not lose the way trying to find support. And it seems to me for you it's important and needed to feel that you are not alone, that you are the community of like-minded people, and each member of this community is important and will be supported. I really want you to inspire each other and to inspire those you help, just like you inspire me. Every single time during the regional visits, I get inspired immensely. I get charged from you since you're so passionate about your work and our joint aim. I really want to make you happy as well. That's why today we are announcing a special award from All Ukrainian Mental Health Program, How Are You?, which the communities and individual centers and innovators and solutions will receive at this forum. I do hope that today we will find the best. Once again, thank you, dear friends and like-minded people, all of you working in different sectors, different conditions with different experience. But you do your work for common cause and developing and taking care of Ukrainians and giving them moral strength. Unfortunately, we cannot heal all the wounds, but we hope that we can give everyone who is in pain the feeling of support and understanding that we care. We cannot cancel all the trials and challenges, but we can help rise after that and become stronger. Once again, I want to say you're not just a community, you build resilience. Thank you, and please never underestimate yourself and your capacities, because the resilience of one person is the resilience of millions. Thank you. It is about the ability to train your life, not to run away, but to live. Resilience is about priorities. It is about ups and downs. It's about decisiveness, plans, and willpower and fight. Resilience is the ability to live. It's about compassion and love. It's about boundaries, about directness, about being able to catch what's important on the go. Resilience is about boundaries and being direct. You know, raising from something you wouldn't raise before. Resilience is about every person. What if the resilience is about the whole country? Yes, the resilience is about the whole country, diverse, immense, and united we stand. So, ladies and gentlemen, mental health in the agenda of the government. Right now it's one more lens via which we're building the approach to recovery and resilience. The war has shown us so many new needs that didn't exist in peaceful life, and that pushed to rebuild a lot of processes, rethink a lot of processes, and it makes sense. Mental health is in absolutely all the policies and sectors. And how can we reach this aim? So I'd like to give the floor to the Prime Minister of Ukraine, Denis Shmyhal.
Dear First Lady of Ukraine, dear participants of the forum, our defenders, dear colleagues, dear friends, dear partners, ladies and gentlemen, It has been 2 years and 9 months of the full-scale invasion, which showed us the resilience of the Ukrainian people, primarily of our defenders on the front line. Every day of intensive and complicated fight requires different kinds of losses, and the psychological pressure is one of our enemy strategy that we do not let them realize. I am very grateful to the First Lady of Ukraine for the fact that she has introduced the mental health policy into our policies. The All Ukrainian Mental Health Program initiated by the First Lady is implemented at different levels and brings its results. These are comprehensive events with the human-oriented approach with different stakeholders involved. And all of this is reflected in concrete actions. Our state increases the number of employees which provide psychological support. Since the beginning of the year, 22,000 of Ukrainians received vouchers to study mental health topics. Our doctors underwent MH gap training from the WHO. A lot of students, they are studying to be psychologists, medical psychologists. And mental health services, they are free of charge and they are included into the medical guarantees program. A lot of Ukrainians were able to use these services, and we are doing our best for these services to be accessible and available at the primary healthcare facilities. And this is one of our further aims, to organize such centers in cluster hospitals. We also created the network of resilience centers. A lot of hromadas, communities, they are involved in this process, and anyone can seek support from these centers and receive mental health assistance. Fourthly, we focus on our children. In the field of education, there are more than 20,000 workers on mental health, and the educators, they go through different studies in order to help people, children who struggle with mental health. We also implement different programs for our combat veterans when they transition from their military service to the civilian life. The most important is requalification, engaging in sports, engaging in different civic activities, and so on. The main factor is helping people remain resilient are family, children, and work. That is why state programs on protection, family, childhood, and the system of requalification and employment are also important components of the comprehensive policy of protection of human resources. A lot of ministries are involved in all these events, and we are working with all the stakeholders jointly in order to make everyone more resilient. The investment in mental health of our people is about future. We need to accumulate our inner strengths, our inner forces in order to restore our country to grow and develop. And we cannot allow for mental health burnout, but we should add resilience and determination. Ukrainians, they are facing very ambitious tasks, and we will, of course, implement them. We have all the resources and the desires for it. I'm grateful to everyone who is involved in this process. First and foremost, I am grateful to the workers contacting people, because you are doing a great job. You are building a foundation of the future Ukraine. You are saving people's fates and people's lives. Together, we will go through the journey towards just peace, and we will save our country. We will save our face for the future of our country. Slava Ukraini. The Prime Minister of Ukraine, Denis Shmyhal. When the full-scale invasion started, it was necessary to take prompt actions, to give prompt responses to different questions from different fields of life. we had to respond to that extraordinary situation that we faced. And at first, it was about humanitarian response. Ukraine is extremely grateful to all the partners who were providing their support, who were providing different services, supporting our country financially, and they continue to do so. This support remains extremely important for our country, and we will always be grateful to our friends and partners. And how was that cooperation formed? And we will talk about that now. I'm giving the floor to Irina Vereshchuk, the Deputy Head of the President's Office of Ukraine. And I'm also giving the floor to the WHO representative in Ukraine, Yarina Habicht. Hello. So, Irina, the floor is yours. Thank you, dear Olena, dear First Lady, dear Prime Minister, dear colleagues, ministers, dear participants, dear guests, dear friends. Recently, we have crossed the line in 1,000 days of full-scale invasion. I'm coming back in my thoughts to the first months, to the first years of 2022. Why did we survive back then, and what do we have to do now in order to become victorious? And at that very moment, I realized that our mental health potential is our treasures, and our mental health is very crucial for Ukrainians and for Ukraine. That is why our First Lady, Olena Zelenska, in the summer of 2022, assumed the leadership and gathered everyone, all of us, around the mental health program. How are you? Ministries, regional authorities, local authorities, civil society, volunteers, international partners, everyone knows their role and their place within this program. We have a program, the action plan, institutional capacity. We have human resources who are very driven to do this. We have everything necessary to implement this program very successfully. I would like us to applaud and thank the First Lady for her leadership, because it's crucial. Mental health is not only about psychosocial support. Mental health is the state policy directed at support for our resilience and endurance. I would like to thank the Ministry of Health and other ministries who have the programs. They took the leadership. I would like to thank the Coordination Center for Mental Health, which plays a vital coordination role in this process. I would like to thank the civil society volunteers who are doing great efforts, and they are the mandatory component in all of our activities. And of course, we would like to thank our external partners, to our donors who also support us financially. They are providing us their expertise, different trainings, different learning courses, all of which is very important for us. Let's thank everyone by applauding. The WHO is the permanent partner of the mental health program. How are you? It is important for us, not only for the WHO, but for the rest of humanitarian actors, coordinate their efforts with the government, with our partners inside the country understand where they need to strengthen the role of the state, and we want everyone to be on the same page, and then we will draw that synergy which we badly need here in Ukraine and in the whole world. I completely agree with the words of the First Lady that we have what to share with the world. We have what we can demonstrate and teach the whole world. I would like to ask you, dear Jarna, in your opinion, what is the main problem? What is the main problem in the creation and development of mental health program? How are you? And of course, what is necessary and what role you will take in order to solve this issue?
And thank you. And I'd like to thank you as we are here on the stage, but also First Lady, Prime Minister, Minister of Health, other ministers, but actually everybody in this room, because whatever problems we have ahead, mental health or others, actually staying united is contributing also to resilience and also how we can address any challenges on mental health. Today's conference, today, tomorrow, day after tomorrow, is about resilience, and I think mental health is a very important part of it, and health sector and all the sectors have much to do. First Lady was mentioning what has been learned from different countries, different experts. Some of them are here in the room, some of them visiting Ukraine. So I like to thank of all the experts who have courage to come to Ukraine, because we should talk about Ukraine in Ukraine. And we have learned from various countries what to do in Ukraine. But I think we are now in the level at what was mentioned also. Ukraine can give much back to the global level. Ukraine has been spearheading the World Health Assembly resolution on mental health, and that's very, very important together as Ukraine and the Kingdom of Netherlands have led this process, because that's exactly the resilience we are talking about. It's the international diplomacy that has been there and contributing that mental health is there in the middle of any crisis, war, and future challenges that we have. So while you are asking what are the challenges ahead, I like to show also that Ukraine is addressing many challenges within Ukraine, as we have marked 1,000+ days of the war, but also internationally. Lancet Committee is another example. But what I like the most as we are coming now to the second forum is what is happening in the next 3 days, because you are sharing your experience within Ukraine as well. Somebody comes from Rivne and says, I found a solution. Somebody is in Lviv saying, I did it in this way. Colleagues from Zaporozhye are coming and saying, I tried it in this way, being just 30 kilometers from the front line, but I still invest to mental health. Colleagues who are working in Kharkiv, they are looking how to support the children to still being able to go to school. So you're learning also from each other. And that's why these forums are so important, and that is something that also contributes to the resilience. I like to thank everybody, because you have been addressing those challenges every day in communities, in hospitals, in primary care centers, across all the sectors. And this unity among Ukraine partners and international partners, as today I'm here only speaker, but we have tens of international partners, UN agencies, development partners, various colleagues who are investing in mental health. And that goes back to the leadership. You started to talk about mental health since the first days of war. That takes courage. But that is extremely important. That has helped us to come to this phase. We have more than 100,000 colleagues in the health sector and beyond trained in MHCAP. This number would be much smaller if we wouldn't start it early. We have community mental health teams available, which are multidisciplinary teams, exactly what many countries are developing just now. We have the resilience centers, we have connection to the social sector. if you ask Irina what are the challenges, the challenge is we need to do more. But I think if we look back to last year, and this was mentioned by First Lady, by Prime Minister before, we have done more. The key question is that war is not good for health. There are others who are fighting the war. We in this room, in the health sector and beyond, need to do our job to contribute to the resilience and better mental health. So I like to thank everybody. I like to thank all the healthcare workers, others who are investing to mental health, and that they would have a chance to ask from each other, how are you? Because the stronger are the people who are working on mental health, the stronger is the society. So the key is to keep that army of mental health people in the good shape, and then we can meet again in 1 year. Thank you.
Thank you. Mr. Yarna says that we have to continue our efforts. It's extremely important for all of our international partners to understand that the war is going on. We need increased support, more dynamic support, and the necessary support. Sorry for the tautology, because it is crucial that the coordination we had in 2022, 2023, lasts through 2024 and 2025. It becomes even stronger because we have strategies, we have a clear plan, the government knows what it does, the civil society knows what to do, all of us know what to do, we just need support and coordination. I am very grateful to you, and we badly need victory. Glory to Ukraine. Thank you, Irina. Thank you, Jarno. Thank you very much for this dialogue. And dear ladies and gentlemen, let's applaud the Prime Minister of Ukraine for taking part in our event. In fact, around the All-Ukrainian Mental Health Program, how are you? There is a whole network, ecosystem, and within this ecosystem, there is the government, the partners, the non-governmental sector, expert and scientific communities. And at the intersection of different energies, there come different decisions, unique decisions, which are become the first in the world. Today, we will see the puzzle of the mental health sector in different sectors, in the veteran policy, in sports policy, and on the screen you can see the figures from the different regions of our country. This mental health service permeates all these sectors, and you can see these figures on the screen. In order for, I can see that people are taking photos. Okay, I will step aside for you to take them. So we want to make this puzzle and create a full picture, but of course it requires the work of thousands of 10,000 people providing this service and those who are using this service. Now we will delve deeper into this sector of health. So I'm giving the floor to the participants from the health sector. Let's applaud Alexander Prokopchuk, the director of the Primary Facility Center from the city of Zolotonosha, the family doctor. Alexei Vlasov, the managing director of the medical center of the Dnipro Regional Council. Tetiana Holovko, the current director of the Regional Clinical Specialized Hospital in the Sumy Regional Council. Andrei Burachik, the director of the Rivne Regional Hospital of the War Veterans. And let's applaud Yuri Kuchin, director of the National Medical University, named after Oleg Bogomolets. And the host of this discussion will be the Minister of Health, Viktor Lyashko. Dear Minister, the floor is yours. I'm happy to see everyone here. Dear Minister, you have 50 minutes for this discussion. Please follow the time. I wish every one of you strong health and mental health. I am happy to greet you in this hall, and it's great that we can discuss today our achievements in the health sector, particularly in mental health sector, and the way we achieved all of this. I will have some questions, and after that, small questions like 4 or 5 answers. If we remember where we started, then we started from referring to family doctors to give us a shoulder, a hand, because we were launching the All-Ukrainian Mental Health Program. This is the biggest army of the trained specialists who can help us identify and address the mental health issues. As the practice showed, when we announced that it wasn't perceived in a positive way right away, because there was a reaction to the fact that the family doctors will be responsible for something else. Then people thought that the psychiatrists will become family doctors, but we managed this whoosh together. I would like to ask my colleague, who was one of the first to join the program, how did you motivate your employees to engage into mental health support? How did you motivate them grow and develop in a MH Gap program? How did you communicate with the colleagues from different sectors, whether their reaction was different? So, Alexander, the floor is yours. Thank you. In fact, when we were preparing for this event, Irina highlighted a very interesting question which I can resonate with. This is that at least when I was studying to be a doctor, we were not prepared for this, and all the knowledge that the family doctors have, they managed to acquire them at their workplace. In fact, this is a lot of work which was done by the WHO, by different ministers, by civil society actors, and by us, family doctors. This tool, MH Gap tool, is a groundbreaking tool. Our region was one of the first to implement this tool. In our facility, all the doctors and all the nurses underwent the course online, which was not enough for us. We sought support from our WHO partners, and thanks to them, our region has trainers on MH Gap, which conduct studies according to the peer-to-peer approach at their workplaces. We were inviting psychologists, psychiatrists to our facility, and they were also conducting different trainings at the request of doctors. For example, the prescription of pharmacotherapy, on how to announce distressing news to the families of fallen soldiers. And we also engaged a psychologist. We were working very actively according to the package 51, which is dedicated to the support for adults and for children with different mental health disorders. Every family doctor has forms, and we identify a lot of hidden depressions, a lot of anxiety disorders. In fact, we have made a big stride, and now it is when we are starting to argue with the psychiatry about the relevance of prescription of these or those psychotropic medications. We have done a lot in this direction. The motivation follows later, because at first we have a request which is very big. Our community survived a few strikes a few months ago, and the referrals, the self-referrals, they have increased exponentially, and the request is the demand is very big and we need to respond to it, which requires a lot of training. Correspondingly, we are looking for different formats so that it is also interesting, and our doctors, they are ready to embrace it. Sometimes we get defensive, which is a normal person's reaction, but it goes away over the course of time, and we understand that we are the first contact person, doctor. We need to know how to distinguish and discern between somatic pathologists and mental health pathologists. Thank you very much, Alexander. Thank you very much to your team for being us in the program. And now I am telling this to all the family doctors from the 1st of January 2025. This is your duty to provide mental health support, which is not included in the package. It is just your duty. There are different courses, online, offline. You can learn from your colleagues' experience. And a very short question. All of us understand what the physical health culture is. And what about the mental health culture? Oh, it's a very philosophical question. This is what we are working on. We are working on the formation of this culture. We understand the legacy from the Soviet Union, and we need to forget this legacy. That is why I think that the mental health culture is what we are working on now, right now. Thank you very much. Let's applaud Alexander. After the primary healthcare facilities, we understood that we were creating resilient centers, and we needed to create the referral road to receive support from highly specialized specialists. Back then, we started creating the mental health centers in multi-profile hospitals. Now in Ukraine, we have the regulation, we understand the functions, we understand what we have to do, and from the 1st of January, we will reformulate this package. But a lot of facilities, they achieved this even without the ministerial policy. They started creating different mental health centers. For example, the Center of Family Health in Dnipro, and I'm giving the floor to Mr. Vlasov for him to share why they started to do that, what became the foundation, and how they managed to launch this center in their facility. A few words about our hospital. The regional family center is one of the biggest children's hospital, which is very close to the combat area. From the first days of the full-scale war, we became the medical hub, which provided medical assistance to injured children. We have a lot of workers in our country, and I'm very proud of them. Despite the safety situation in our region, everyone is staying in our city. They continue supporting and providing assistance to our children. Now we have lost our workers. They lost someone. Every day we face different adversities, which of course impact on the mental health of our employees. We can treat a child, but we need to provide mental health support to the patient and to the family of the patient. This year, upon the invitation, I managed to visit one of the European countries when we saw different systems of mental health support for children. We visited Denmark, where my colleagues and I managed to see their system at different levels. And in fact, it became the beginning for creation of such a center in our hospital. As of today, the center is working. We are providing support to children, to our employees, to their families. I would like to tell you about one of our first patients, a young woman from Mariupol, whose husband was captivated by Russians, and the children were seized and taken to the Russian Federation. Thanks to our policy, they managed to return the children, and this woman, she started to work in our hospital. Every time when we receive the injured children after the massive strikes, and we also engage the mental health center workers in order to provide support both for the patients and the families of those children. I would like to say that after Olena visited our center, we got inspired and we launched an outpatient mental health department. When our pediatricians saw the benefits of such centers for our children, two of the pediatricians, they decided to reskill their knowledge, and in the upcoming future they will work in the mental health center. But we do not only rely on international practices, we also rely on the practices of our colleagues. For example, we have colleagues from Lviv with whom we will work in the future. I believe that such centers, they are very relevant and they are very important now and will be important after our victory. Thank you.
Thank you, Alexei. Thank you. I want to thank your team that in all Ukrainian mental health program, you keep on working and you develop the services which are so important for our children and their parents. A question to you. So I see it that to manage the facility is not as easy as it seems. And to manage the children's hospital, it is very difficult in terms of the mental health preservation, because all of us are parents, we have children, and when we can see children with diseases, we worry about them even more than probably what needs to be done. So what makes it possible for you to preserve your mental health resilience? My family, my children. Thank you. I can develop this topic and ask what's happening and how do you preserve mental health in your family. That's a difficult question, especially for top management, when there isn't much time for the family. Could you say a few words on that? How do you preserve mental health in your family? How do you preserve mental health balance? Every weekend, be that Saturday or Sunday, I try to spend it with my family, with my sons. So that helps us stay and keep, this mental health atmosphere in the family and to take care of each other. Thank you. So when we speak about primary health care, we've introduced MHGAP, we work, detect. A mental health center is about understanding that there is a group of experts which will help cope with different issues. And not always we can help on this level, so that's why there are narrow specialized hospitals helping us treat diseases when on the level of prevention we couldn't cope with the situation. I really get it how difficult it is for health workers to work there. So a question to Tatiana. How do you manage to retain and motivate staff who always see complications, who always can see psychiatric diseases? So how do you unite them? How do you prevent burnout? How do you manage to respond to the challenges that we have in our country these days? And what are your plans for the future, Tatiana? Thank you, Victor. The question is very urgent these days. Our hospital is the hospital of Sumy region, which unites 3 divisions in 3 different cities, Ochtyrka, Romny, and Sumy. And from the beginning of the full-scale invasion, all of us were cut off from each other. And the team was, like in despair, in fear, lack of understanding. And over time, over this 1,000 days, I observed the mental health of my team, and I can tell you that this condition always changed. And we united. We united in different social projects. We engaged in different volunteering activities, but it wasn't enough to preserve mental health in our teams. In this system, human to human approach, empathy is important, but when we saw that our system is overloaded with social patients who lost their relatives, who are brought from the frontline territories, usually without documents, with acute conditions, and over the last year we could see enormous increase of our defenders in our hospital. So this empathy in the team started sometimes causing, emotional burnout, and we observed that, and we did our absolute best to impact and prevent these processes, because we wouldn't like to feel careless, and we want to stay as a hospital providing high quality medical and psychiatric services to our patients. And in this regard, thank you to the All Ukrainian Mental Health Program. How are you? Thank you to the Coordination Center for Mental Health. We participated in a wonderful project strengthening the capacity of health facilities and building resilience of health workers. And thanks to our participation in that project, we managed to support our team. We managed to provide the services to our staff, supporting their resilience, because their resilience is so important for us in the region close to the front line to preserve the capacity we have these days. As of today, the project is not over. It's over formally. We worked 4 months. 3 clinical psychologists provided both group services and individual counseling sessions. And we understood that building psychosocial service in the facility is important. So we want to continue working in this direction, and I want for the system of professional resilience of health workers to be embedded into the general health system. Thank you. Thank you, Tatiana. Thank you so much to you and your team. But let's have a discussion together. So name top 3 factors motivating the team to work together and solve global issues. Top 3 in your opinion. What are they? Salary, number 1. What else? So the motivation in general, it is about the salary and social support. So this is the motivational factor which is common for all people. And there is one objective, one aim. It also unites people. I want to thank my team that we managed to stand up to it. We are resilient, and it motivates me as well. And one of the factors is also the leadership, because I can't simply live without monthly meetings with my team to listen to the problems which are not even about the professional area. So it's one of the factors as well, to be close to my team and to be a leader. Thank you. Thank you, Tatiana. Let's applaud and thank. At the same time, with All Ukrainian Mental Health Program, we're developing the network of rehabilitation centers. This is highly important, and we understand that from the moment of the full-scale invasion, the big number of severe traumas are here. These traumas are so difficult to treat, but it's even more difficult to recover the person via rehabilitation. I understand how difficult it is to live through each unsuccessful rehabilitation case. It is so difficult for the multidisciplinary teams to live through that. These multidisciplinary teams, which were created as a part of the law on rehabilitation in the health sector. But when we launched All Ukrainian Mental Health Program, we understood that these multidisciplinary teams lack one person, and that person was the mental health worker. And right now it's mandatory for all the multidisciplinary teams in the rehabilitation centers to have a psychologist helping both the person who is going through the rehabilitation and the team providing rehabilitation services. So today in our panel discussion we have Andriy Burachik, who is the head of the Regional Center of Spinal Trauma. So could you share how the peer-to-peer principle helps us solve mental health problems. I know that tomorrow we will have a separate blog and panel discussion related to this topic, so maybe you can announce that to encourage colleagues attend that panel. Andriy? Thank you. Well, Rivne Regional Hospital of the Veterans of War back in 2015 started admitting our defenders. Back then it was anti-terroristic operations defenders for rehabilitation. The rehabilitation was being built in the country, rehabilitation centers were being created, and we also created the base in our hospital for rehabilitation. In 2018, we already opened the unit of neurorehabilitation with the capacity of 50 beds, and we started admitting severe condition patients after severe brain trauma and spinal trauma. And back then we engaged psychologists to help patients. And from 2020, when we started contracting with National Health Service of Ukraine, and different laws and resolutions came into action about multidisciplinary teams, the multidisciplinary team was created, which included a psychologist who worked together with the team on rehabilitation of the patient. Thanks to the support of the Ministry of Health, thanks to the cooperation with the World Health Organization, with the help of the experts from the World Health Organization, experts from many countries of the world, from 2022 helped us create the Center of Spinal Trauma. As of today, the capacity is 100 beds. We cooperate with the experts of the World Health Organization, and we've created 10 multidisciplinary teams, which have the psychologists, and no meeting of multidisciplinary team happens without the participation of a psychologist. The particularity of our facility is that we have the cottage houses, which are very, very similar to what it's like to live at home. Also, I'd like to speak about public-private partnership. This year, between the Rivne Regional Military Administration and the private company Nova Poshta, the memorandum of understanding was signed, and as a result of this memorandum in the territory of the hospital, 10 module houses were built, and they are absolutely accessible and inclusive for patients on wheelchairs. I mean, those are patients after spinal traumas and severe brain traumas, brain injuries. And these houses are used for one of the stages of rehabilitation, and on average, patients are for 3 or 4 months on rehabilitation, and before the patient is discharged, the patient goes to these houses for rehabilitation where the person lives in to maximum similar conditions as at home. And we also invite the family members to work together with the multidisciplinary teams, including the psychologists who work together with patients and the family to ensure the next future life in the family for the patient. The rehabilitation has to be comprehensive, and psychological support has to be there on all the levels of rehabilitation. Thank you. I want to thank you, Andriy, and your team. And it's not a blitz question, but it's to continue speaking about cottage houses. In your opinion, the presence of the family during rehabilitation, I mean the wife or the children, the chance to live together, does it help in psychological rehabilitation for the person? Does it motivate the person to do faster and to fulfill the recommendations of physical therapists and ergotherapists? Occupational therapists? We know that it really helps, that it really motivates the patient in the process of rehabilitation. And also it prepares the family to perceive the patient and to continue living with such patient. Thank you, Andriy. And blitz question. What can make you lose control, and how do you cope with that? Well, I lose control when I want to do something. I have the capacity, but there is no time. I want to have it here and now. I want to provide care already right now and to create something. But how do I cope with that? Seeing these patients, I can see their heroic actions and deeds. I cope thanks to my family and thanks to everyone. Well, first of all, I want to thank the President of Ukraine, Volodymyr Zelensky, the Ministry of Health, First Lady. When I come out of my office and I can see how the new huge block center is being built, which will make it possible to provide rehabilitation services from acute period to long-term care. Thank you. Thank you. It's not blitz, it's fast and long, but thank you. We expect that in 2025, the new innovative block to treat spinal trauma will be commissioned in our national center. So, now let's move on to education questions. Our position in the Ministry of Health: everything we do temporarily to improve knowledge needs to be institutionalized in the curricula. So we understand that we have the donors support, partners support these days, but then if it's not a part of the curricula, it may be lost. So for us, it's a key point, and we thank that we were listened to and heard, and MHGAP started being implemented into curricula in our medical universities. So, of course, I want the universities under the Ministry of Education and Science to implement MHGAP program as well, because it's highly important. So I'd like to give the floor to the rector of the National Medical University, named after Bohomolets, Yuri Kuchin, who will share his secrets with us. A, was it easy to implement MHGAP into curricula? And B, how the students perceive this course, because they may not understand what problems they will face when they graduate from the universities. Thank you. Thank you, Victor. I'd like to say that it's not just about how easy it is. I want to say how important this action is. Because when we want to get the knowledge that we want our doctors to have, and we heard all the participants said that there is the lack of knowledge, and I can testify that we weren't taught that. At least we have to have three components: the name, the content, and how to deliver this content. So the name, all of us took the courses of car driving, and we learned that it's emergency care course, but it was neither like about medicine or about emergency medicine. So despite the fact that we named this course the basic information on mental health, it's important for the content to comply with the validated courses. That's why we want to help with that, and we want to thank for MHGAP tool, and we fully implemented it without like dividing it into hours or years. If the course is validated, it has to be delivered the way it is. The third component is who should deliver this knowledge. It's highly important for people who can actually do it, share this knowledge. So we want to thank for the possibility to prepare the mentors who are certified people, and we know for sure that these people will be able to implement this course, share the information, and convey the unique content that's there. The next point, about students in general. I've already said that we train all the students of all the medical specialties: pediatricians, rehabilitologists, specialists on medical psychology. All of them get this course, but we won't stop at that. After the graduate level, on postgraduate level, we train people who didn't have the clinical education. That's clinical psychology, and I hope that in the near future it will be about pastorship and psychotherapy for people without medical education and degree. But then again, it's important for this knowledge to be validated, because we've faced the situations when some universities launched some programs with good name but unclear content and unclear lecturers. So it's highly important to avoid that situation, because right now it's we already have not just dollars for delivering the baby, but also dollars for death. So here it's not about money. It cannot be about money. We have to do our best to preserve the nation. And finally, I'd like to say not only about the formal education, because we implemented that into the programs. I'd like to speak about how we can teach our students mental health hygiene. Those who went to the medical universities, a lot of you who are here studied at the medical universities, you know how difficult it is to study there, how stressful it is. So we shouldn't just learn at the medical university. We have to live there and we have to go through that together with the students. It's not just about education, science, sports events, and other events which may interest the students. I can tell you that when you play badminton with first-year students or when you run the marathon with all the students, they have an absolutely different attitude both to education and motivation. Thank you. Thank you. I know that your colleagues in Ternopil, Ivano-Frankivsk, opened the offices of mental health support with the focus on the students who study at the university. Do you have such mental health office in the National Medical University? Well, in the National Medical University, we don't just have the office, we have the system of care. We have the old tradition of medical psychological faculty transformed last year into the Institute of Mental Health. And from the first days of the war, this Institute of Mental Health took a very important function to provide care on all the levels, starting from the biggest, broadest level. I mean, the search for the answers were in everyone, like from chatbot all the way up to the in-person contact with the specialist who can provide the care. And a blitz question, but please expand your answer a bit. For many people who are not a part of all Ukrainian mental health program, very often, or many people often may have a question that, alcohol helps us deal with problems. So I'd like you to comment whether alcohol is the partner in mental health support or is it an enemy? And could you please provide a reasoning? Out of my experience, no. Let me provide the reasoning. So the thing is, alcohol does not help you get rid of the problem. It just helps change the attitude to the problem. And if we're speaking about the fact that under alcohol intoxication, the person may look at the situation like a bit softer, but one way or the other, alcohol will stop its effect sooner or later. If not, if we somehow keep on using alcohol, there will be consequences. My first profession is the emergency doctor and the anesthesiologist. I made money when I was the resident. But from this perspective, I don't recommend using alcohol as the first solution. Thank you. Let's applaud to Yuri. So we have limited time, but one blitz question to all of you. Each of you should provide 2 examples which you use in your practices that help you support your mental health. Alexander, 2 methods, whatever it is. What keeps you going? I really like driving a car. So the first thing is traveling. Preferably long-distance traveling. And the second thing that helps me is family time without devices and mobile phones, because mobile phones make people anxious. Thank you, Alexander. Tatiana. Well, what helps me, I like reading, and whenever I have a spare minute, I get distracted by reading, and if I have time, the walks in the nature, in the forests, that's amazing. Thank you. Alexei? As I said, for me it's really important to spend time with my family, especially with my wife, especially without children, when we can go out for a walk. So it's one of the mechanisms. It's nice that you go out for walks with your wife, but that's my visit to my motherland, to Ternopil, to visit my parents and to communicate with my wife. Yuri? Communication with my loved ones, my family, my friends, students, and the bike. Anesthesiologist is here. So, colleagues, thank you. You could hear the advice from the health workers on how you can help your mental health. And me, I will tell you 1 minute. So we could hear the advice. Feel free to use them in your practice because it's almost evidence-based practices which are in all the recommendations today. So today you've managed to see the numbers, you've heard how we managed to achieve the changes. So right now I'd like to say thank you and thank on behalf of everyone who launched All Ukrainian Mental Health Program. I want to thank all health workers. I understand that you're not the whole program, but you're a part of this program, without which this program wouldn't have happened. And the world sees that. Yesterday I had a meeting with the WHO partners and Hans Kluge, General Director, and they asked to say the support words to you because they are impressed with the resilience of Ukraine and health workers, and they are impressed to see the changes we have, that in these tough times and these short terms we've managed to do such global things. We have to be proud of that, but we shouldn't stop at that because we have a lot of problems that we face and we need to cope with them. And I see that without the support, we won't make it, and our system won't make it either. So with these gratitude words, I want to thank Olena Zelenska for political leadership, because we have this program. I want to thank Oksana Zbitneva for the Coordination Center and the work of the Coordination Center, and I want to thank our international partners that are with us, the World Health Organization, UNICEF, USAID, and all the governments of all the countries who give us the hand to support us and move with us together. And the part of these successes is the part of your support, because we succeed thanks to you being with us. Let's applaud and thank our partners and everyone who motivates us to keep going. And I see that today there will be awards, and someone will be awarded today, but it doesn't mean that everybody else did their work in their own way. We cannot give all of you everything right away, so we need to motivate you to come to the third forum. That's why on the second forum, one person will get the award, on the third forum somebody else. So do something, think, implement new ideas that will benefit both you, because usually that helps cope with problems. Like what helps me cope with problems is physical exercises, activities, running, gym. For me, this is the priority because I feel absolutely different after that. And the second block, after the family comes first. Greetings to my family because they watch right now me, and I haven't seen them for a long time. So I can say that the experience helps to change. And when you achieve the results, it helps. When you set the global aim and you break it into parts, and part by part you achieve the results, you understand no matter how hard it is, you keep going because there is a result that inspires you to keep going. So no matter how hard it is for all of us, set achievable goals, achieve them, and you'll feel these emotions which will help us preserve our psycho-emotional health in the right condition. And a short remark, comment. I was in the hospital that the International Medical Partnership was signed with Denmark, and I was taken into the center of dementia. After the war, that'll be one more challenge that we have to start talking about, and we have to take this experience. Denmark is about LIGO, and they say that LIGO is the powerful tool to prevent dementia. So right away I called my wife, because I have a huge Formula One LIGO, and I told her, let's put the LIGO together. So try to find something that helps you preserve your mental health in the right condition. Thank you. Thanks to everyone, to all the health workers who are here in the panel discussion, in the room, at workplaces. Thank you. And I have high hopes that with every single day, month, year will improve our mental health. Thank you. Thank you, dear Minister, dear participants. Right now, we will move on to our first ceremonial part. As First Lady said in the very beginning, we will provide the awards of all Ukrainian mental health program, and the speakers and the panelists will receive the certificates from How Are You? All Ukrainian mental health program. So, October 10, Mental Health Day, there were regional awards. About 600 people were awarded, have facilities, organizations all over the country. And right now on the stage, those who were nominated for these awards as regional teams. So, health sector awards will be awarded by Viktor Leshko, the Minister of Health, and the head of the Coordination Center of Mental Health of Cabinet of Ministers of Ukraine, Oksana Zbitneva, will award these prizes. So, How Are You award gets Chernivtska Oblast. Yankova Alexandra, please come to the stage, the deputy head of Chernivtska Oblast Military Administration. They developed the services covering health, education, social protection, veterans recovery, and in Bukovina, 3 centers of mental health started working, providing care to more than 10,000 people in the region. There are more than 1,200 workers finishing the MHGAP training. Applaud. The award How Are You is given to Ovrutska territorial community of Zhytomyrska Oblast. So the head of the community, Ivan Koruda, please come to the stage. In Ovrutska community, there is the psychological support space. I take care of myself, and the mobile rehabilitation care for physical rehabilitation and mental health rehabilitation center for primary health care, and territory of recovery time for yourself. Mobile teams are working, and different projects like taking care from birth at home, and the community provides training for specialists together with How Are You program. Let's applaud.
How Are You awards the Clinical Children's Medicine Center in the Lviv Regional Council. So it's for Olena Kozlova, the director of the Children's Medical Center. This center focuses on the needs of children, and there is a clinic, mental health clinic, providing high-quality counseling for children and for adults up to 24 years old. The graduates of the academy, they also provide trainings there. The award How Are You is given to the National University named after Bohomolets. So we are asking the director to receive this award. And it has been 1 year since the Mental Health Institute started working in the university and training the psychologists and becoming the flagship in this sector. This university became one of the first universities implementing MHGAP training. Thank you very much. The award is given to the City Polyclinic number 1 of the Chernivtsi Local Council, and we are given the award to the director of the Polyclinic, Maria Melnichuk. The facility actively supports the creation of the mental health program in the Chernivtska community. In 10 months of their work, they have provided over 5,000 consultations. Congratulations. Thank you very much. How Are You awards the partner, the United States Agency for International Development, and we are given the award to Yin Su. The United Nations Agency for International Development actively supports the medical programs in Ukraine and the All Ukrainian Mental Health Program. How are you? Let's applaud everyone rapturously, everyone who received these awards, and of course the certificates will be received by the speakers of the discussion. Let's applaud everyone. I suggest that we take a family photo for us to remember this moment. And another round of applause. It's always pleasant. And we will have a lovely picture to remember this day. Now we will have a photo. So let's smile, everyone. Everyone is smiling. Here you are. Thank you very much. Ladies and gentlemen, you have already heard that in Lviv there is an international forum, Veterans Journey Home. The needs of veterans of their families is a crucial component of our country. From one hand, the user of any service, whether in the community-based setting or elsewhere, does not go along separate streets in the cities. People use the same streets, they visit the same family doctors, they visit the same administrative services, facilities, stores, but at the same time the chain of provision of services when it comes to veterans has to be adjusted to the needs of the person with combat experience. So now we will talk about the journey home of veterans, and we are giving the floor to Natalia Kalmykova, who is in Lviv at the forum, but she will join us right now. A few minutes, please. We are trying to set up the connection. Both events are very important when it comes to mental health. So there are two events, one in Kyiv, one in Lviv, and the minister attends the forum in Lviv. Now we are setting up the connection, and in a few seconds we will listen to the minister's speech. There is no connection. We can get back to that later. Or if we can wait 1 minute. Okay, so 1 more minute and we will hear the minister. By the way, the minister was telling about the Lego. I don't know why I'm 38, but I face the game for people, for seniors, which is Mahjong. I installed it just so it is on my phone. I haven't played it yet. I'm dragging the time. I'm trying to understand that it's too early for me to play this game for seniors. But of course, everyone has its own means, whether it's a Lego game or hugging their parents, hugging their children, because the children, they are waiting for their fathers to come home and hug them and kiss them. When you come home at 11 p.m., it's really great that we have a curfew. There are some benefits because our children can see us earlier at home, and this brings us more energy to wake up next day and live our life. I understand that we will get back to the minister later, and now we will transition to another session, and we will be back to that one a bit later. As a matter of fact, so what is in our focus when we are talking about the mental health services within the education sector? This is not only about a school psychologist. These are trained teachers, educators, social educators, parents, and other caregivers responsible for all of this. The most important is to teach children, adults to be emotionally competent and to be able to support themselves and seek support if needed. The service is not a room with a place that there is a psychologist, so this is the core of any system. I mean the specialists and their preparation in the educational facilities. Again, this is about the trust we put in the professional. Then we will proceed with the education panel, and I'm giving the floor to Lyudmila Kostyukevich, the teacher, the deputy principal of the preschool gymnasium number 76 of the Kherson City Council. I hope that our speakers are somewhere close. You can see that we are changing the panels very quickly, but I hope that everyone will be here. Lyudmila Kostyukevich, if you are here, so please come up to the stage. It's time to start your panel. I'm giving the floor to Svetlana Pokynborodu, the practical psychologist and social educator of the gymnasium number 3 of the Myrhorod City Council in the Poltava region. Viktora Yevdokimova, director of the State University, Zhytomyr Polytechnic University. Valeria Politi, Vice President of the National Psychological Association, the Academic Director of the Psychological Programs in the Kyiv Economy School, and Natalia Maz, the Head of the Department of Military Psychology and Pedagogics of the Military Institute in the Taras Shevchenko Kyiv National University, the Colonel Natalia Maz. As far as I understand, Lyudmila Kostyukevich will join us later. The host of this panel, of course, will be the Minister of Education and Sciences of Ukraine, Oksan Lysovay. So, Oksan, the floor is yours. You have 50 minutes. Thank you. Dear community, dear colleagues, I am sorry I'm a bit sick, so if I have a cough, I'm sorry in advance, but illness cannot be skipped. It is obvious. This is not COVID. This, of course, can be prevented. You know, I have been having this runny nose for a few days, and everyone is asking me, are you okay? Will you come to work tomorrow? So, dear First Lady and the whole team, I'm very grateful to you for placing a focus on the problem that is not obvious, which is invisible. We do not often think about it, about what the service members' families think. For example, if the service member loses connection with them for 4 or 5 days, even when, for example, a husband calls the family and says that we are relocating and you don't need to worry because we will not have any connection. So what do they feel? How do they sleep? Is a big question. What does the boy feel who attends a relatively peaceful region, a school, and we ask what the family of seniors feel who have lived in their house throughout their life. They put their soul into that, and after that, that house was just reduced to ashes. I am very grateful to First Lady of Ukraine, to all the partners for highlighting this problem, for focusing our attention on the importance of this problem, on the consequences which might arise if we do not act actively at all the levels. This system of education is a field which, in its scope, is one of the biggest. We contact with children from the very early age. Our skills to interact with children, to understand the invisible problem is extremely important to solve, to avoid severe repercussions which might arise after this horrendous war we are living through, in terms of destruction, in terms of losing people, in terms of injuries that are inflicted during the war. The Ministry of Education is implementing the project of psychosocial support and psychological support at different levels of education. There are two extremely important components. For example, we're thinking of the psychological service within the education sector and the introduction of the mental health programs at all the levels of education. From September 2024, we have launched a course, Lessons of Happiness, for primary school children, for preschoolers. This course is aimed to form different self-care skills in our children. And all of this is created at the all Ukrainian national level. We had different reviews, ranging from positive to skeptical. Sorry, Mrs. Kostyukevich will join us later. She will join us and we will ask her about the practice, about how they institute these lessons of happiness. I will proceed with the second part. We have 160 educators and teachers trained to conduct these lessons of happiness and train their colleagues. The lessons of happiness is also about another pilot project on which we are working in the frontline areas. This pilot project is about a different approach to psychological support which caters to the needs of our people. Then I'm going back to the question. So, lessons of happiness. Could you tell us how do people perceive these lessons of happiness? What reviews you have, feedback you have from the parents, from the children? The educational facility of the Kherson City Council, we have participated in the pilot project Lessons of Happiness. The program provides for teaching small children, because the pilot project is aimed at the primary school children, when a child can take care of themselves. This project helps not only to teach a child, but also children, parents, which is very important. Such a three-pronged system with the teacher, parents and children is very fruitful. When we were conducting the training, the educators mentioned that the program brings out emotional intelligence. They also noted that working with the trainers, we can really teach children not to be afraid of stress, not to be afraid of taking another step forward themselves. Being in the Kherson region, the pilot project that we are offering for the Kherson region, we saw that children in the frontline areas, they are afraid. We can see it in their eyes, and fear interferes with their development. It interferes and blocks their psychological processes. We cannot appoint a psychologist for every child, but if a teacher, an educator teaches self-care support skills to parents and to children, we will have great results, and we need to move forward, because everything that we do is for the future of our children. Thank you, Ludmila. Now I would like to talk to a practical psychologist directly about what components in the big project that we are working on within the sector of education in terms of the modernization and reforming of psychological service. Where do you want to pay your attention to? What do we have to work on even more? What components do we have to change? Svetlana, the floor is yours. Thank you. First of all, I am very grateful for being here in person. I feel a certain kind of responsibility for representing the psychological services in the education sector. Of course, our work has drastically changed since the onset of the full-scale invasion, when we faced a challenge that all of us have experienced the war. Everyone has different experience. Some people were living under occupation. Some were forced to leave their homes. Very often the relocation is very hurtful, and our children have to bear this. A lot of our children had to leave our country to go abroad with their parents, but not everyone can find themselves there, and the children, they are not here and not there. A lot of our parents, husbands, wives, mothers, fathers, children of our teachers, they are fighting on the front line defending us, which also brings a different kind of experience. Under such conditions, it is crucial to adopt a trauma-focused approach and support all the participants of the learning process. If before we were focusing more on children, on prevention programs, now we have to put even more focus on that. And these lessons of happiness, they are vital, as they are about bringing back joy to the children, and they are about teaching them to understand what they need to do in terms of self-care. It is important for the education to stand in front of the educator, because educators are the first people our children contact with. Our educators, they see our children's emotions, their conditions. Now, it is often the case when there are some manifestations of psychological mental health disorders, for example, depression, and a lot of children, they have depression. Educators, as the first contact people, have to understand where to put their attention to, and to refer to a psychologist in a timely manner. The key moment is that educators need to know how to provide first psychological aid along with the first medical aid, because educators, they are next to the children very often. Then there is another component, which is the technical staff. Very often we underestimate them, but they are also around our children. There were cases when the children affected by the war, when the teacher was reading a story and the discussion followed, for a child, it was hurtful because of the previous experience, and a child can leave the class and go to the hall, but an educator cannot leave the other children. That is why the technical workers, they are also important, because they can provide support, validate children's conditions, and refer to psychologists. After that, practical psychologists can provide a more professional kind of support, because we have special methodologies, technologies, and understand whether there is a need for referral to a psychiatrist, to other centers maybe. The direction of work in terms of implementation of trainings for educators, for technical staff, and how to provide first psychological aid. The basics of crisis intervention is very important because they are the first contact people, and after that, the practical psychologists or social workers. Another important point is that very often we compare that in order to provide more professional counseling and work with parents, a lot of parents, they are serving in the army, they are on the front line, they are coming back. When we are going through the course on how to work with the military fathers, because there are some nuances, and children can also be traumatized by the situation after their parents come back from the front line. The service members, they are emotionally usually closed. Our educators are also emotionally closed very often, as our mental system works for self-preservation. And apart from the professional burnout, our educators also have emotional, cognitive burnout. When an educator comes to school and to see a child needing support, but the support is also needed for an educator in order to continue to carry on their work in an effective way. That is why there is a big need for such courses, for support groups for educators, maybe for some centers, because very often a stable adult is an educator. It is important to pay attention to that. Of course, if before the practical psychologist didn't work with the topic of grief, with the support for a child who is grieving with the ambiguous loss, now, and they have to teach children different subjects. Apart from that, the important component is supervision and intervention support for educators. All of us know that we work according to the confidentiality principle. When we are working with a child who is grieving, or with a family who is going through ambiguous loss in their families, we face certain challenges. We cannot come to our colleague and share the situation with him or with her, because we have to keep everything confidential. This professional field has to be ensured for the educators, where we can seek advice from our colleagues, strengthen our skills, our needs, in order to carry out our duties as effectively as possible. That is why the mental health system in the educational facilities needs to be reformed, as we faced the challenges that we didn't have before. Now we have to understand what we can do for our children to recover. Thank you, Svetlana. I agree with you. Very often we say that the war has separated our school children into different categories, into those who are under occupation, those children who live in the front lines or in relatively more peaceful areas. There are different approaches, as people, they have gone through different experiences. This has to be also taken on an individual level. All of this requires a system which will be dedicated to train the specialists. In fact, it has to be a systemic service, high-quality service. it is important for a psychological service to work at all levels of education, from preschools to universities. The university services in particular can provide services to communities. They can become the basis for psychologists, for students to practice, to develop their skills. And Victor, I am interested in the way this system works in your university. Can you tell us about your successful practices? Thank you, dear Oksana, dear participants. I would like to thank you for being here with you and to be able to share my experience, our experience of resilience story of our university and this center of the mental health services. In fact, at the very first glance, it might seem that the mental health service at the university provides mental health services to students, personnel. Yes, it was like this when we just started, but after that, the full-scale invasion broke out and our principles, our values, priorities evolved, and we faced a lot of challenges. Of course, we work with students, with educators. We have 9,000 students, 700 employees, and everyone has gone through some losses. We need to understand how to work with these losses. Unfortunately, we have a very saddening data that at the very beginning of our activities in 2016-2017, there was an anti-terroristic operation. Thank God we only had 4 students who died defending our country. And now we have 80 students who sacrifice their lives for the future of our country. And for this is the loss for our university, for our family. And we started working with this category of people.
At the same time, the Center for Veterans Development works at the university providing the professional help to adapt to the situation. It works from 2016, and we understood that for this category of students, they need psychological support, and the center also provides this care exactly at the university. We keep on working with the families of our veterans. We work with the families of the died defenders. Especially it's difficult to work with the little children, preschool children, or elementary school children who suffered losses. Some of them lost their homes, others lost health, received the traumas as a result of the war, and others lost the most valuable thing, the mother or the father. And, you know, working with these children is very difficult, but using the theory of post-traumatic recovery, we are trying to show that there is life ahead. And we have the unique experience when we contacted one of the authors in Sweden, Julian Rice, who issued a fairy tale, published a fairy tale for his daughter who was severely ill, and we asked for the copyright and the translation into Ukrainian. We published it in Ukraine, and right now a lot of psychologists use this fairy tale with this aim, to help such children who have such losses. Of course, the experience is big, and I want to say a lot today, but taking advantage of the opportunity, I understand that we have limited time. I want to share an announcement that makes us happy. Very soon in Zhytomyr Polytechnical University, in our center, there will be the series of training from a famous for all of you professor, psychology, doctor, the member of the Association of Psychologists of the US, Richard Tedeschi, who will share his experience how to combat the war trauma and what to do so that after the trauma, this post-trauma recovery would be successful. So please, follow our announcements, and we will be glad if you follow these trainings, join the training. The founder of the theory of grief and post-traumatic recovery, and a lot of psychologists use his methodology. So also I want to say thank you sincerely from the bottom of my heart, because it's highly important. I want to thank Olena Zelenska for your all-Ukrainian mental health program. How are you? And you know, a lot of people say about it today, they thank for that, but why is it important personally for me? Because this program is functioning during the war, and when we learned the experience of the countries which had the war, very often, in most cases, such practice appeared after the war was over. That's why it's important to have it during the war. Thanks to you and your team. I want to thank Oksana Zbitneva because in your coordination center for mental health of the Cabinet of Ministers of Ukraine, you put enormous effort to coordinate the activities with the regions, to cooperate with the universities like ours, with the usual university centers. I want to thank for the possibility to strengthen our work. That inspires. I want to thank today Arsen, because not many people speak about it today, but this year, and in so many years in the past, there was the increase of this public order for psychologists. I want to thank everyone who is here today, who is following us online, who works at the workplaces, and I want to thank all of you that we work and we do our best to preserve and multiply and strengthen the mental health of those around us, our loved ones, friends, family, and ordinary Ukrainians. Thank you. Thank you. Thank you, Victor. Yes, we really have the request for psychologists, which enormously increased, and psychology is the top specialties that students choose entering the higher educational universities. For bachelor's degrees, we received 53,000 applications. It doesn't mean that all the students entered the universities and will study to get this degree, but 10,000 students chose this profession and study this year. It is important, and it really makes sense that we increase the public request for this profession. This is the problem that we as the society has to work with. So also the society increases the request for psychologists, and this is the response to that request. After the full-scale invasion, people started asking more often for psychological support from the specialists. So, Victoria, what is it that we have to review and revise in our educational curricula and approaches? Hello. So, you know, I lost my voice a little bit because I got sick, and yesterday I was quiet the whole day to be able to say something today with my voice because it's an important topic. Actually, teaching psychology at universities faces a lot of challenges. These challenges are related both with the theory that is provided in the universities and practice, which has to be gained by the students. We all know that from the moment of pandemics, COVID pandemics, a lot of the universities started online education, and they continue it due to the safety issues, because not all the universities have bomb shelters, and not in all the bomb shelters you can continue studying during the air raid sirens. So let's just think how you can study online with such disruptions and polish off practical skills. That is so difficult. A different thing is theoretical knowledge. So here there is, well, you know, a lot of lecturers unfortunately left. They continue their professional development in other countries. Probably some of them will come back to Ukraine, but not all of them. So the lecturers who are in Ukraine, they don't always have colleagues they can rely on. The other thing is methodological guidebooks and books in general, I think that it's not a secret that psychology was idealized for many years. It's not just about mental health, it's about persuasion and managing people. That's why before the full-scale invasion, most Ukrainian universities unfortunately used the Russian books, published books in the Russian Federation. Or these were books written in Russian by Ukrainian scientists because it was easier to sell the books in Russian. And right now, after the full-scale invasion, our universities faced the situation that there are basically no books. Well, there are some books written by Ukrainian scientists, but it's not enough. And these books, they can't always cover the demand. And not all the students can read English, and not all the universities can afford to buy the books in English, and not all the universities have the access to the scientific libraries. And that is the theoretical challenge. One more thing is practice, and polishing off practical skills in such safety situation that we have right now is difficult to have practical activities with students and to have any practice in the classes of the universities. It is difficult. That's why I think that the system of psychologists' preparation these days has to be reconsidered, because in 4 or 6 years the specialists who will graduate the universities, they will be able to replace us, and they will help people who return from the war, who will recover after the military actions. And these have to be practitioners who know what needs to be done, who understand modern approaches, not some old Soviet approaches, outdated approaches. That's why I think as a scientific community, organizationally on the national level, we have to do our best to strengthen them so that not just formal specialists would graduate with the specialty 053. Like, we have to make it happen for graduates to finish the universities, because you know that they have also postgraduate education. But anyway, these specialists, after the graduation, they have to be able to provide some basic services at least. My university is the private higher education university, and we have enough capacity, sufficient capacity. 2 years ago, we launched 2 programs on psychology based on the Kyiv School of Economy. So we're trying to integrate them to maximum into the European space, and the programs we developed and we address other universities maybe to do the same. We designed the curriculum from scratch, from square one, which complies with the minimum European standard of psychology, which means that there will be the balance of credits, of disciplines, subjects, which comply with the European requirements. On the one hand, it can simplify the academic mobility for the students, and this academic mobility is not just about losing the student when the student goes abroad to get the master's degree. It simplifies the mobility in between the terms, or the mobility related to some courses. And secondly, it pushes us to comply with the standards and to provide the practical skills which go like in line with the modern requirements. And we've increased a lot of practical activities. We've increased the number of practice at each year of education. To maximum, we prioritize for ourselves, and we engage the specialists to lecture who don't just have the experience of classical university lecturing, but who are the practitioners who work or who run researches in some narrow specialized topics. And we do our absolute best for our students to have the good quality literature, and we strengthen our staff. Those who don't confidently speak English, we help them speak English better so that we would have this window and contact with evidence-based psychology from all over the world. Thank you, Valeria. So for us, the audit or the analysis of how psychology is taught at the universities with such demand is one of the priority tasks. The prioritization of scientific researches and like expansion of international collaborations. And scientific researches in psychology have to be highlighted because unfortunately we become a huge research base. And it requires the structural decisions and the creation of the necessary centers both at the universities and the working groups which will work in this area and in the National Academy of Science and other academic institutions. Such structures have to be created. But one more block which needs to be highlighted is the professional preparation of military psychologists. Natalia, I'd like to ask you, the request for these specialists is huge, and a lot depends on the quality of work of these specialists. Mental health and well-being of our military service members depends on that while they are in the service right now and when they leave the service after the war and reintegrate in civil life, in peaceful life. So what is the specifics of preparation of military psychologists? Please share. Hello, the participants of the forum. Greetings. First of all, I want to thank the First Lady of Ukraine and Oksana Zbitneva and the Coordination Center, because this is truly the program that's not just about the functional responsibilities, it's about every single person. If we're speaking about the preparation of the military psychologists, starting from the very beginning of the launch of the program and way before that, the university named after Shevchenko launched a powerful work on supporting the lecturers and students because it was an urgent need. But the military institute, I will speak about the time after 2022 because before, even despite the war, the programs and curricula differed. But before, the war was a bit further away from civil life, and after the full-scale invasion, it actually entered every home as the rocket attack or strike or air raid siren. So right now we take care not only about the service members at the front line. In the military institute, we follow two programs to prepare the students. At the same time, we understand that to prepare a psychologist, let me highlight military psychologist, it takes a lot of time. That's 5 years and a half. The country right now has no time to wait so long, and we're preparing our students right now. But you rightly mentioned that right now a lot of the combat teams, units are deployed and they need psychologists. I want to thank psychologists who came as volunteers or who were reserved and recruited, and they started working with the service members. We responded right away because even highly motivated civil psychologist still has to know the military specifics. Combat activity differs significantly from all the other activities, and that's exactly why the courses of psychologists' preparation, apart from the basic military element, was one more element, the specifics of work in the combat area, like the support of the personnel in combat actions, and like they have to understand what changes happen after combat actions. And so our military service members had to learn how to contact civilians after they come back from the military actions. All of that became a part of the preparation and qualification increase, and the Military Institute always works on clearly responding to challenges. The lecturers in the operational groups are sent to the areas of military actions, and they track the processes very quickly. If in 2022 we noticed that the most common was acute stress reaction, but after a while we started understanding that there is burnout, exhaustion, and absolutely different situations had to receive attention. All of that is flexibly put into the preparation programs and curricula, and we respond to such requests. This way we are trying to respond to the challenges. If we are speaking about the preparation quality of military psychologists and about the cadets, we're talking about, well, there is no time to adapt people gradually. We have to prepare our psychologists after the 4 years of education. They go into the army, and most of them after the graduation, after a few days, they are in the area of military actions. We have no time for the smooth transition. That's why we're trying to engage our cadets to the practical activities during the education, and on the final years of bachelor degree, we join them into the work of rehabilitation centers, in the recovery centers, and like the recovery of personnel after military actions. We join them to the work with injured and in the hospitals. Why is that important? Specifically at this time, they learn with the specialized psychologists who will monitor how it goes. And our psychologists are learning right now how to provide the care to those who need it. On the final years, we can send them, for example, those who have bachelor's degree but they are studying for master's degree, like in terms of the program of reintegration of freed captivities, they can work there, or in crisis aid after the strikes and rocket attacks, if it's necessary to send people there, like the second line worker with the manager in the area of personal recovery. Like via this practical component, we're trying to do our best to prepare our psychologists to their independent work. Well, that's the way we prepare our psychologists. Thank you, Natalia. Really, the work with the military service members is a separate block of problems, and we understand it has to be divided into 3 components: before, during, and after. These are sometimes not very similar tasks. These days, Ukraine deploys the system of preparation of civilians to the resistance, and these programs are introduced in the schools. That is the first entry point to the challenges that our citizens may face. I'm not just speaking about military challenges. Anyway, I'm speaking about some traumatic events that citizens may face, and the preparation to these events starts at schools before the traumatic events occur. They are prepared to technogenic disasters, military challenges, environmental issues, some other cases which can traumatize the citizen. We start preparing at school. Then in the universities, starting from the 1st of September, we also educate students there. It's important to prepare before the emergency, then the work during the emergency when the service member focuses on something else, and sometimes the person cannot even focus the response to different events. That's an important element during the emergency. And also the next stage is the return to the full and sufficient life as an element of the preservation of human capital. So the work of the military psychologists is in the focus of attention of the Ministry of Education and society in general. So I want to thank all the panelists. Thank you for sharing your thoughts. But first of all, I want to thank you for your work. I want to thank you, your colleagues, and your institutions. I want to thank all the educators who are consciously approaching the problem of mental health on all the education levels. I want to thank everyone who actively studies, who reads, who watches a lot of different courses and trainings created by our Office of Mental Health as well. I hope that we will decently respond to the challenges we face. And I want to thank our partners who don't leave us all alone with this problem. I want to thank all the organizations which supported the projects, institutions, and people solving these problems. And I want to thank Olena Zelenska to you. Thank you. Colleagues, thank Thank you, Arsen. I want to thank all the participants. Please stay on the stage. And traditionally, after the discussion, we move on to the awards. Oksana Zbitneva is rushing to the stage without the invitation. Of course, welcome on stage, Arsen, Oksana. So let's get started. So the award, how are you, goes to Kharkivska Oblast, Vita Kovalska, deputy head of the Oblast Military Administration, and the support of children with special needs and the creation of conditions in the educational space. That is the award for Kharkiv Oblast. In the region, the Oblast program of educational development, the education of Invincible Kharkiv. Kharkiv was one of the first to approve the concept of the development of mental health in Ukraine. Kharkiv National University, named after Karazin, together with Ulks University, develops the trauma-oriented approach course for mental health to train psychologists, social workers, and other providers of psychosocial services. Thank you. Also, how are you? Award Gluchivska Territorial Community, Sumska Oblast, Irina Tereshchenko, the head of the Gluchivska City Council. Gluchiv City Council, despite the challenges and the status of the area of possible military actions, despite evacuation, stands strong to all the challenges. About 70% of children had to leave that territory, but the educational process is preserved, and it's their students and lecturers do their best to continue the education. Let's applaud to them. How are you award goes to Lyceum number 5 of the city of Krasnograd, Kharkivska Oblast. We invite Larisa Pughachova on stage, the head of the Lyceum. Krasnogradska community right now is the only community in the region where children have hybrid educational program, and Lyceum number 5 is the flagship of this process. They have the motto, a creative approach to work and love approach to children. They go ahead of time in technologies and they work in difficult approaches. Lyceum number 5 was one of the first to implement the happiness lessons for first graders, and right now lecturers get trained. Let's applaud to them. How are you award goes to the Ukrainian Catholic University, so we invite to the stage Svetlana Kohut, the Dean of the Faculty of Sciences about Health. One of the strategic aims of this institution is to develop the wholesome model of mental health care for students and workers, and the global aim is to scale up this in the network of the educational institutions. On the Faculty of Health of this university, they started the master's program, clinical psychology with psychodynamics and occupational therapy. UKU is the active participant which builds the mental health system in Ukraine. Bravo! How are you? Highlights the partner in education, the representation of UNICEF in Ukraine, the head of the UNICEF, Munir Mamadzaleh office. The UNICEF office in Ukraine with the mandate to support children, teenagers and parents. Apart from all the sectors where they are actively present, they implement mental health programs. One of them is the resilience centers in Kharkivska Oblast, pilot in transformation of school psychological service in Kharkiv Oblast, and the development of youth projects. UNICEF supports How Are You program aimed at children and parents. Let's applaud. And of course, all our participants of our panel receive the certificates, and we invite you to come on the stage to have a wonderful picture. Let's take a family picture. So all of you have the awards and certificates. That's awesome. Please get close to each other, closer to me. Scooch here. A bit more. Is it okay? A bit more, scooch a bit more. One step towards me. Get close. Just step to the left. Step to the left, not to the right, to the left. Oksana, please stand here. Oh, Minister, you have the certificate as well. Okay. Let's smile for the camera. Great job. Thank you so much. Thank you. Now let's go back in time a little bit. If everything is ready, I mean go back according to the agenda. You see that we adapt to all the challenges we face, and you can see that everything is happening in real time, just like in real life. We may not always have what we want to have, but the way we respond to it is the response to how we can adapt to the reality. So basically, we've had this situation right now, but it's not a big deal. So Lviv is connected, right? In half a minute. So let me remind you, maybe you missed that information. Right now in Lviv, there is International Forum of Veterans Way Home. That is a highly important component of mental health of our country. And right now we have the Minister of Veterans Affairs, Natalia Kolbakova, there. And right now she will be live with us. So, Natalia, you're here. We can see you. We can see the forum. We can applaud to each other. Kyiv, Lviv. So, greetings. Natalia, if you can hear us, if you can see us, the floor is yours. We'll be glad to hear your speech.
We can see the video. We haven't had it yet that everything is done so quickly. So once again, let's talk to the host of the event in Kyiv. They have the International Mental Health Forum supported by the First Lady of Ukraine. Can you hear us? Yes, we can hear you, we can see you, and we are ready to listen to Natalia. I can see that you can see me, just not if you can hear me. Yes, or you can give another sign. So, a voice in my head says that they can see us, they can hear us, they are not just smiling for nothing. We can carry on, and I'm happy to announce Natalia Kalmykova, the Ministry for Veterans Affairs. Hello, dear Kyiv from Odessa. Glory to Ukraine. It's the second time when I am in Lviv, and I skipped the issue of mental health, but for us it's a big honor to combine two events, the International Mental Health Conference within the All Ukrainian Mental Health Program of the First Lady of Ukraine and the Veteran Forum Journey Home. These two events, they are inseparable. Mental health questions, issues are not only about health, but also about national security, social stability, well-being, and recovery, restoration of the country after the end of the war. When we are talking about the priorities we have in the veteran policy, we mean health first. Physical health impact on the mental health of veterans. The second priority is the families. The way the family feel also impacts on the mental health of veterans. Then economic independence, whether people have enough money, whether they do what they want when it is interesting to live and fulfill themselves in real life. State guarantees whether the services are provided timely, whether a person managed to receive all the necessary benefits or statuses, whether people perceive veterans warmly, whether people meet veterans and put a hand to their heart, whether authorities understand their needs, whether the graves of my comrades are attended. We can identify that the veteran is a trigger and an indicator of the mental health of our country. According to the survey of the Veterans Foundation, the psycho-emotional instability is considered by the majority of the respondents, and the rest of the people, they believe that it's very likely in the future. All of this testifies to the fact that there will be a great demand for such services. It is necessary to provide quality mental health support as soon as possible, because mental health is about harmony, about family, about community. And we are reaching the point that all the aforementioned leads us to the fact that the mental health system for veteran support has to be integrated and take into consideration all the aspects of the veteran's life. It has to kick into gear from the very first period of military service until the very end of the life. The main beneficiary is a veteran, but the beneficiary is a family, community, and the country on the whole, even the world. The integrated, comprehensive approach is about mental health going beyond just medicine. We have to take into account different aspects of well-being of our veterans. All of this is provided for in the strategy on the veterans policy, which will be approved in the nearest future. Then the cross-cutting model of support from community-based services to highly specialized hospitals. We need to provide for the smooth transition of support for a veteran to receive the kind of support he or she needs here and now. Such services have to be accessible and affordable. In our world, when we are talking about mental health, it's something extraordinary, because our parents, our grandparents, they didn't know such things as telemedicine, as mobile brigades, as community-based multidisciplinary brigades. All of this will help us make the services for our defenders accessible. And last but not least, but we cannot implement all of this on our own, because it takes a village to raise a child. It is very important for us, for our ministry, to take part in the All-Ukrainian Mental Health Program, How Are You?, which is instituted by the First Lady of Ukraine, Olena Zelenska, as the program spans and covers everyone: children, wives of veterans, mothers, families of the fallen soldiers, the families of the people in Russian captivity, employers, communities, and the veterans themselves. I would like to emphasize that today, within the work of the ministry, we are working on the changes to approaches of financing and selecting the mental health providers for veterans. We will increase the cost of these services so that more high quality, highly specialized specialists join us, people who will impart their competences, their knowledge for others who also need our care. I would like to express my gratitude to talk at your conference about the Veterans Affairs. This day is a big day for us. I hope that what we are doing will measure our being humane from the ministries, from members of parliament who are engaged into this process, to the implementers at the grassroots level. I am very grateful to our defenders, to everyone. I wish you a long life with sound mental health. Thank you very much. Glory to Ukraine. Thank you, Natalia. Thank you, and we are grateful to Natalia. Let's applaud Natalia, Lviv or Odessa. We do not know. They would like to mix them up. So now it's the rate alert, but a little reminder that we are already in the minus floor. But if you need to take shelter in an even more safer space, you can go to the parking lot. But we will carry on here. Traditionally, after the speech, we need to give awards. So now we are proceeding with the award. The Deputy Minister for Veterans Affairs, Ruslana Velechka-Trefanyuk, and of course, Oksanu Zbitneva. The stage is empty, so come to the center so that we have a lovely picture. So, an award, how are you, is given to the Vinnytsia region. We are asking Natalia Zabolotna, the first deputy regional head, systemic approach and devotion to the cause so that every defender is heard. Saying this, we can describe their approach on implementing the veterans policy. They have been working on it since 2016 and have taken part in lots of different projects. How are you is given an award to Medjaybiska territorial community of the Khmelnytska region, and we are asking the regional community, the head of the community, Alexander Tkach. Their community provides support to the families of veterans, encourages partners to cooperate with them even more, and there was another important project, the Memory of My Generation. They conducted genealogic research, they learned the history of their area, and they cherish time spent with the families. An award is given to the Rivne Regional Military Hospital, and we are asking the head of the hospital, Andriy Burachenko, to come to the stage. Psychological counseling, individual and group therapy, art therapy, kinesiotherapy, music therapy, and the list is not exhaustive about the services provided in this facility. There is also an administrative service center. Every week, our defenders can receive consultations on legal matters and social matters. There are also 41 houses for round-the-clock rehabilitation for the veterans, for service members and their families. We are giving an award to the Mykolaiv City Council for City Center for Veteran Support, and Mykolaiv Center is one of the barrier-free spaces with a spectrum of services designed for rehabilitation, including legal support, social support, and other kinds of support. Thank you very much. How are you? Award is given to the Dnipro Regional Council Mental Health Center, and we are asking the head to come to the stage. The center provides comprehensive support for veterans, starting from legal to social adaptation, especially to those who are receiving prostheses and other kinds of rehabilitation. And by the way, they know how to interact with people with combat experience and how to employ them. The center conducts open trainings. How are you is given an award to the partner in the field of non-formal services to the International IOM, and I am asking Olesya Skjavm to come to the stage. The representative, together with the Coordination Center for Mental Health under the Cabinet of Ministers of Ukraine, facilitates separate services for veterans at the community-based level within the cooperation of the MHPSS Technical Working Group. And let's take a joint photo. You are very lovely, so I'm asking our photographers to take a lovely photo of you. Great, let's give them a round of applause. Here you are. Thank you very much. Another round of applause. We are very grateful for your efforts, for your tremendous work. Dear ladies and gentlemen, I have great news. We are ahead of time and we have more time to have a rest. So now let's check our clocks. At 14:15 we will start our next session, so please be back to this room timely. And now you can have some rest. At 13:15 you will have lunch, and of course take lots of photos with each other, engage in conversations. We have great photo areas, and you can see also the result of veteran business work. We support the businesses of veterans, and during the break you can get familiarized with them. There are different sweets, honey, treats which were made by the Ukrainian veterans. And again, it is important to give your positive feedback. So at 14:15 we are coming back to this hall.
Життя – це майже як поїзд. І це він просто зараз нас мчить крізь мережево колій. Це як
It's like a journey without a ticket. And you're going so fast with any idea of where you're going because there are just brief stops behind the window. Despair. Fatigue. Uncertainty. Anxiety. Try and ask yourself, how are you? How are you? How are you? It's like the beginning of a conversation, of an important dialogue. Search for answers and solutions. A place that is so close and convenient. Every place where a human contacts a human, because all problems are finite. While human resilience is infinite. And every new habit brings new strength. The invisible engine. This is a continuous chain, and the actions that are always invisible, one after the other one, step by step, they build the system, with you in the center of it. You have a new request, and the government provides new services, because if we restore the person will restore everything. How are you? Resilience, a guide through difficult times. So, ladies and gentlemen, with this video we're starting the second part, because the how are you for us became the guide through tough times. It's always close where it's convenient, where the human contacts the human. These simple, short words, how are you? But they mean so much. So, ladies and gentlemen, thank you for getting back here after the lunch break. I hope you are all recharged. I can't hear you. Have you managed to recharge your batteries? Give us the feedback. Are you ready to continue? That's better. Please applaud to each other, cheer each other up, charge each other for the right tune that we need during the second part. So really, today we mentioned many times on the stage that Ukrainian experience is quite unique about a lot of things globally, but of course, it has the prefix traumatic experience, and as a society we have to learn how to live with all these experiences without hurting each other while we're interacting with each other. We have to take care of each other and try not to hurt each other. But it's also about the fact that the service cannot be the way it used to be before the full-scale invasion. Before the full-scale war, this service has to be towards the person, seeing its need and building the choice for resilience. So let's speak about building resilience. That is a separate service in Ukraine and an approach to changing the orientation from other social services. We will talk about all of that. Let's applaud, and I will invite the participants of this discussion onto the stage. Olena Homich, the head of NGO Center of Integration, social manager of the Resilience Center of Rivnenska Territorial Community. Please come to the stage. Svetlana Kniha, deputy head of the Bakhmatska City Council of the Chernihivska Oblast. I invite Irina Roshkovich, deputy head of Zakarpatsky Regional Center of Comprehensive Rehabilitation for Persons with Disabilities. I invite Valentina Voitkova, the head of the Department of Social Policy of Vinnytska City Council. And I invite Oksana Boyko, the head of the School of Social Work of the National University Kyiv Mohyla Academy. And the head of this panel is the Minister of Social Policy of Ukraine, Oksana Zholnovich. Oksana, please come to the stage. So, ladies and gentlemen, 50 minutes of your discussion starts now. Hello, dear participants. I'm so glad to moderate our panel of social protection today within this big forum on mental health. How are you? I want to briefly share the innovations on how the social sector can become the partner of medical sector when we speak about social support, psychological support, and the preservation of our mental health. Because according to the pyramid of the levels of mental health, the first and the most basic level is actually to be able to listen to the person, to show compassion, to talk to the person, to give a chance the person to feel that he or she is not alone, simply to explain the information that's necessary in the specific time, in the specific place. And that will significantly reduce the stress level, reduce the level of confusion and the level of possible problems in the future related to mental health. That's why we are the junior sisters and brothers of the doctors who are aimed at preventing a lot of Ukrainians coming to them, so that we would just hold them in our warm embraces and not let them get into the exacerbated condition. So our social workers, all our staff have a task to provide the person with the feeling of warmth, understanding of the situation, grounding if something unpredictable happens in the life of the person, just to give a chance to spill everything out, to feel the emotions, and to provide the first basic skills on how the person can work in the situations and conditions which were created. So by essence, everything we're doing is aimed at stabilizing mental health of people. But there are some unique elements, because when all of us got together and tried to find what is it that could be the flagship program project for the Ministry of Social Policy for social sector within How Are You program, we really wanted to show something unique. We wanted to give fresh life to our social sector. We wanted to show to maximum the warmth, support, friendliness that unfortunately isn't very developed in our communities for now. I want to sincerely thank Olena Zelenska that together we went to Israel and we could see how their resilience centers work. And I want to thank for many, many hours of discussion about this service. And this service ended up being unique, because for the first time in history at state budget, we engaged not only communal enterprises, but also NGOs, non-governmental organizations. For the first time, we've managed to show the partnership. We're all partners in our country. We all can fulfill the social roles and responsibilities. All of us can work to benefit our people. This practice is widely applicable in many countries of the world, but we are only at the start of it. We've just started implementing it. So I'm so glad that as of today, we have more than 200 centers working, and that's only this first year of work. And I'm glad that millions of people received services in these centers. I'm so glad that we increased the number of specialists, almost 1,000 specialists who are engaged into providing this service these days. Goes without saying that it doesn't cover the whole need, but of course we want to develop, standardize our services and create new programs, improve the services available. That's something that we aim at. But we've already set the foundation, and I'm glad that the first center that was opened was the center in Rivne. So I want to give the floor to Olena to share what's it like to be the first. Hello. Good to welcome all of you here. I'm so worried because when we work in the field, I always worked in the public sector for more than 10 years. So when the full-scale war started, we created the so-called hub, where we welcomed IDPs at the railway stations, and together with the National Service and the military administration, we helped them, placed them, and back then we could see already the challenges. Here in the panel, we're all worried. We spoke with the ladies, so please support us. Let's breathe together to calm down a little bit. So let's do it together. Breathe in and breathe out. Breathe in and breathe out. Well, that's exactly how we start our trainings and activities in the resilience centers. Unfortunately, people coming to us need to be taught how to breathe. A lot of people rush, a lot of them, due to the fact that they cannot breathe the right way, they make bad decisions to keep on rushing, never to stop, not to live here and now, not to integrate into the community. But our resilience centers, there are 9 of them in Rivne Oblast, they provide 37,000 requests. It's not all of them. So a lot of them started working just now. So we have a lot of different stories. And yesterday when I was sitting and preparing, I thought the most important thing is not to cry, but the most important thing is that in my territory I have a lot of psychologists in 1 square meter. So yesterday we followed all these methodologies, and that's how we start all the meetings. So also I'd like to say that these are thousands and thousands of stories which are invisible for others, which we have in our resilience centers. This is the only project which scaled up, and it trains us systematically. It trains great specialists, our psychologists, social workers. They come from these trainings with new methodologies, skills. We have our self-help trainers here among us. On top of that, when I attended self-help training for the first time, I thought, to listen? And what? Just to listen? And right now we're implementing such trainings, and I can tell you that people, they don't want to talk right away. They want to listen. They want to get off the hook. Also, there are so many stories that, for example, one woman, an IDP, came from Bakhmut and she says, I'll go back home tomorrow, I'll go back home tomorrow. And she keeps on saying that 1.5 years. She was going back home in her thoughts. She didn't give her son for integration because she believed that tomorrow she will take a key out of her pocket and will open the door of her apartment that no longer exists. So our achievements, it's one of these stories. Right now this woman works, she's a nurse in the regional hospital, children's hospital, and she comes to us like, the person who's lived in that region for a long time. She comes and helps, and we have IDPs working in social sector who work with people at the reception of the evacuation process. So we wrote the project, huge humanitarian fund for Ukraine, and we created the algorithm of evacuation. And we thought what to do next. How can we hire the workers? We have 2-floor building, big room, and there the Ministry of Social Policy announces the contest, and we jump on that wagon, and we didn't regret. Right now we're repairing the 3rd floor. We don't have enough space. It will be the minus 1st floor, just like we're in right here, so that it would be as a shelter and people would feel safe, because a lot of people, they are still traumatic, they are anxious, they don't know where to go. Yes, we will have 3 other rooms there, so we are ready for cooperation. Also, I show everything around as if I am the real guide in our center. So a lot of people come from different regions, a lot of people come to from our communities in Rivne Oblast, and we also do visits. I can say that it's a crime to know about such project and not to speak out about it. We all commit a crime when we're quiet. When we went into the communities, because our head of the Oblast Military Administration gave us this task, we visited to all 64 communities. We have 9 resilience centers and 29 submitted for this project. I want to thank Lyudmila Perederi. I know that she is somewhere here among us because together with us she worked on that with from each community. With each community, she spoke about it, and as a we're as a brand in the region, people trust us. They can see that we have an absolutely different working approach. Like, the universities come to us and they ask to have internship in our place. So our specialists go to the universities and lecture the students. Since we work in the fields, we face different problems that unfortunately students aren't aware of. And since the whole oblast and the resilience centers worked with us from Berezivsky Resilience Center, I want to provide to Oksana Zbitneva and Dolyana Tokareva the presents, the Ukrainian dolls, handmade dolls, Motanka, which was created by the resilience group. The members are 60 plus, so when they found out that I come here, they prepared these presents for you. So thank you.
This is for you. Thank you. Please take this one. And when Oksana Zbitneva visited our place, she asked why there was no logo on our shoppers. This is a resilient Ukrainian doll for you. These women, a lot of them lost their relatives or loved ones. And by crafting such dolls, helps them to live in the present. Those are the reparations that we can provide to our people. Thank you very much. It is very touching to hear the interaction that unfolds between people. In fact, you heal yourself because you receive even more an emotion which lets your wings be open. I always say that I might not orient on the region, on the district, but I cannot avoid communities, because nothing we are planning or doing in our offices is possible if the communities do not embrace it, if there are no specialists representing our social policy. In fact, I come to realize that millions of our people do not realize who the Minister of Social Policy is, what teams work in our ministry, but they will always judge the social policy in our country by the way they will be provided services in their communities, by the way they will be accepted and received in their communities. That is why for us it is crucial to, after the reform, we have 1,500 Hromadas communities. They have their own duties. Unfortunately, I'm saddened to hear that a lot of village heads say they do not need social protection services or social protection departments. It is sad because what does a person need in a settlement? If a person is depressed, he or she does not care about the color of a bench. If a person does not know how to solve this or that issue, of course, repairing the potholes is very great, but this person will not benefit from it if the person is not happy. That is why it is very important. We are working on standardizing everything that has to be present in communities, the number of social workers, the number of social managers conducting needs assessment. obligatory needs assessments for all the heads of communities, for the members of parliament to understand who needs their support and create adequate programs. Programs not about 100 hryvnias granted to people, but programs which really solve issues and change people's lives, because our task as social doctors is to help person get out of the crisis and to see the light at the end of the tunnel, to shift the focus when a person does not know how to help themselves without other people's aid. I would like to give the floor to Svetlana Kniha, representing one of the communities, to hear the way the communities have the development, see the development of social sector. Can you tell us to which extent do you see the necessity for social services within your communities? And I believe that this is one of our main tasks at different levels of authorities, including as the component of the all-Ukrainian mental health program. On the example of the Bakhmut community in the Chernihiv region, I would like to emphasize the importance of provision of comprehensive services, and they are being systemic. Only this combination makes it possible and effective. In our real world, we have to be dynamic. We have to respond to all the challenges the life brings us, strengthen the existing services and institute new services. The standard of provision of services is our social protection centers present in every community. But when analyzing the categories of providers and users, the types of services, it is obvious that the best and the most effectively these services are provided when we have interaction with different institutions at the community setting. That is why in our community there was created a task force, and we held several meetings, and we created a memorandum on cooperation of all the institutions within the community regarding the social services provision. According to this document, every institution has its role within the general mechanism, and we have already created a very effective referral system. And I would like to emphasize that it is effective, not just formal. It is based on direct interaction. Only having direct interaction, we can provide high-quality service and see the problems that we need to work with. Another effective governing solution was to create an intersectoral team. It is often the case that at work we have to make visits to the families' places, families who live under difficult conditions. Usually these families, they need comprehensive services such as medical services, social, psychological, sometimes even educational services. Apart from social workers, the team includes healthcare professionals, psychologists, also representatives of the police force, if necessary, the children's service representative and other service. We signed the memorandum, which was approved by the decree, and we have a social services center, employment center, administrative services center, healthcare centers, inclusive centers, the police department, and other institutions. But we understand that the life is going on, it is evolving, and we are facing new challenges. The demand for social services is constantly present in the communities, but every community is special, has its own features and its challenges. For example, in our community, after the outbreak of the full-scale invasion, we face such a challenge as the provision of urgent emergency intervention. we saw an increase in domestic violence cases. We had to respond to that. The problem was that we had to remove the wife with the children, but we had nowhere to accommodate this person in. The closest center was somewhere in the town center, but such shelters, they were overcrowded because the demand was so high. Our community is a far-reach community. That is why we had to take an effective solution and solve this issue. We found a solution when we were cooperating with the national foundations, and now in our community we have created such a center thanks to the cooperation with the international foundations. Now we are in position to provide this kind of service. There are always challenges. I can talk a lot, but I would like to draw your attention to the fact that our work is based on professionalism, on response to different challenges, and on achieving our major goals: prevention of difficult living conditions, combating difficult living conditions, mitigating the effects of such conditions on people's lives. All of this is extremely important and possible if there is a cooperation at the three levels: local, regional, and national. Only if we have this kind of cooperation, we can build a perceptive community, perceptive of every citizen. Thank you very much for your work in the social sector, for searching for the solutions. Today we have a unique opportunity to better our infrastructure, also using the support from different foundations and international support. But it is important to understand what we create so that it does not just die, but it develops further. Your experience is great, and thank you very much. What else would I like to talk about? When we are talking about communities, there are a lot of vulnerable populations, but there is one quite vulnerable population, and it breaks my heart to understand this, that we haven't solved one problem. All of us say that children are our future. In fact, it is true, because we are fighting for them right now in order to create better life conditions for them. But unfortunately, there are some children, a category of children, who are deprived of the state attention. These children are with mental health disorders. We haven't eliminated the stigmatization of such children. We still believe that an asylum where they will be hidden is the best solution for such children, for such families. Unfortunately, it is not the case, because such asylums, they are torture chambers. They are imprisonment chambers. But they could just work within communities as better institutions. And we spend a lot of money to fund this service. The first thing we need to change is to provide support for such children and mothers on the community-based setting, to provide them with an opportunity to grow and develop, but at home, so that they have an opportunity to create, to start their own families. We have budgeted already pilot project, which we are developing for the first time, which is the procurement of daytime care for children with complex impairments at the community-based level. We will set out the criteria, the requirements, but please, dear representatives of the communities, pay attention to this kind of service, because we need to provide the parents with time to live their life. We have to take care of such children. And today with us we have Irina Roshkovich. She already works in this sector, in this field. She helps the families not to get lost when they give a birth to a child with a disability, and she does everything in order to better the life of such children, for them to integrate into our society. Please share your experience and challenges with us. Thank you very much, Oksana. In general, I am grateful for having me here. I am grateful for feeling unity, my belonging to very compassionate community, because this is our strength, this is our resilience. And yes, it is true that in the Transcarpathia there is a center which created a network of rehabilitation departments where, as Oksana has already mentioned, mothers and families, they receive support. So we espouse the family-oriented approach with the help of our multidisciplinary teams. Of course, such a service has to be accessible and affordable. That was one of our steps, to build such a service and bring it closer to the families. The Transcarpathia is a very unique region. We have around 60% of land, which is the agricultural, which is the rural one. And for us, it is very important to bring those services closer to those users. The earlier we can support the family, the better, because, you know, the first mirror of a child is her mother's eyes. It is very important to support a mother, a family, because if a mother is resourceful, then she will be able to help her child develop and grow. That is why we place a lot of emphasis on psycho-emotional support. We have professional psychologists and our multidisciplinary team, including the speech therapist, social worker, psychologist, and others. All of them, they have the skills of active listening. When we are asking, how are you, we can hear any response. We have to be different and to be say, I agree, so that this mom feel that she is not alone. And the work with family, with children with disabilities, is about work with loss. And we felt it even more at wartime, that this means that we work with the loss of the image of the child, because no family is ready for such a child. But this child was born, and he or she is entitled to be the full-fledged member of this society despite all of the impairments. We are looking for the strengths of a child. We underline these strengths, but not the deficiencies, not the weaknesses. We can build all of this only on strong suits. And together with parents, we identify the level of development of the child and we take next steps. And what is important, it is social habilitation. We do not make people recover. Of course, there are cases of traumas or illnesses, diseases, but the majority of the children, they have to be taught according to their level of development. Just believe me, I am a doctor by training. I would like to have a silver bullet, but I do not have it. But the parents, they are looking for a silver bullet, and they are living through different stages. When first they are informed, then they live through denial, through anger, through shock. For this, we have to be there for them, to understand that we are on their side, that we are with them. And this process is not a linear one. They will go back and forth, but we need to create a space for them to feel this support. We create different groups, and tomorrow I will not be there. You will talk about the peer-to-peer approach. Tomorrow I have to work in the early intervention department. We create peer-to-peer support groups because the stronger the parents are, the more resourceful their children are. In the recent years, according to the development of the inclusive education in Ukraine, we deal more with children, with our children who have some functioning impairment, with complex impairments, with severe cognitive impairments, with autistic spectrum disorders, with behavioral disorders. Parents, they are not in a position, they do not know how to cope with it. And sometimes such children were called as non-teachable. Of course, we got rid of that term, but this is about a challenge. Then we have the departments where we can provide professional support to a mom or support for a child. During this time, this mom can take care of herself, and this is not about being egotistic. This is about being careful and thoughtful about your own life. Parents, they have to be included into this process. First and foremost, we ask about the demands of the parents, because social habilitation is about teaching everyday skills and making children independent. That is why the children and family-oriented approaches are important. We also have the early intervention department, which is a family-centered comprehensive service provided to families with children with impairments, with disabilities. We are sure that it is very effective in case of comprehensive habilitation. During the time of the full-scale war, we have put on the trauma-informed glasses. All of us have to wear them. And as Oleg Romanchuk, a very famous psychiatrist from the Kolov family, I love his podcast. This makes me really resourceful. He says that all the society has to be trauma-informed. Thank you very much for your important didactic words, because of course we need to take into account what is happening to us every day. Unfortunately, we are evolving, we are becoming different from what we used to be. You know, when I was in Scotland and we visited a specific school, we saw children with the Down syndrome, and they were, for example, making crabs. After that studying course, they go and work in cafes, they make crabs, and they are full-fledged society members. And a girl was lying in the bed. She couldn't move or couldn't talk. The teachers showed that all they could do for her was teach the parents talk to this girl, because when they start feeding her, undressing her, she was stressed. But if she has brain impairments, of course, it will lead to convulsions and to the exacerbation of the condition. After that, parents are even more depressed. Every day you take care of your child, and he or she resists because she doesn't understand what is happening to her. But after they have developed these skills, and the child knows that she will have some breakfast now and she's not shocked anymore, this is a big step forward. I would like to have such services in every community. I would like every family to feel support and not go through the hell. I would like to get back to the representatives of the communities, to the representatives of the social protection, to the people forming the policies of particular communities, and they make the priorities about what is happening in their communities. Valentina, can you share your experience from Vinnytsia? What are the new services integrated? How do you define what you will spend your money on according to your priorities? Hello, dear participants. Thank you very much for having me here. I am happy to be here with you and represent our Vinnytsia city territorial community. I would like to say that the social policy, the social sector stays with a person throughout the life. It is very important how the person feels during his or her life, whether this person feels stability or not. So our community works according to three major principles: safety and defense, resilience and care. Resilience and care, they are intrinsically linked, as our priority is a person. People needing support, underprivileged families, families with children with disabilities, IDPs. Unfortunately, those are the families of the fallen soldiers, our defenders who will be returning, and hopefully they will come back safe and sound. All of these people, they need our support. The main task of communities, of any kind of authorities, whether central or local authorities, is to assess and learn the needs of people and to make them feel resilient and socially protected. The Department of Social Policy in our community provides a set of services. If the services are provided in a timely manner, transparently, people will feel better, less stressed out, and kinder, so to say. When they see an official in the administrative services center, if they know how to act with the person, and we are already psychologists, all of us, so you are trying to make the person comfortable, and you see whether this person is ready to talk to you, or if we need to refuse something because we cannot do everything, then you have to be a psychologist. You need to refuse something to a person in order not to stress this person out. It is unnecessary. I would like to share the experience of providing services by communal institutions. Social services are our priorities. The community has to develop them to assess the needs of communities, and one of the provision of social services is the support during the inclusive education. In 2021, our community participated in the project, which was co-financed. The 20% were allocated from the budget, from the local budget, and the rest of the funds were provided by the national budget. Unfortunately, after the full-scale invasion broke out, this service was suspended, but there are also different civil institutions who care about that. That is why, through the social orders, with the social civil society organizations, the children with special needs have an assistant when they attend schools. We also have IDP children. We do not separate them from our children. So everything is for the internally displaced people too, which is very important. At first we started with 9 children, but as of today the number is bigger. These are the children from preschools and from schools. The service is very necessary. We are developing it. We have budgeted some money for 2024, and after forming the budget for 2025, we also budgeted these funds for this service, for the assistance for children with disabilities.
Also for 2025, thanks to the NGO sector, public sector, we have to implement the service, and it is approved according to the standard, that is transit accommodation. In 2022, we approved the order, but everything was put on pause, and right now it is started again. And it makes me happy that this is a very necessary service for children. These are the services for children to stay safe, so that they would understand where they are, so that they would communicate, Both services teach children how to communicate, and it's important, and the parents will be confident that if we take the transit accommodation and children with behavioral or mental health disorders, when parents bring their children to this center, with cooperation with international donors, we are expecting to have quite significant amount of money to open this center, and we will open this center, and the funding comes from Kolping International and the Renovabis. There is also an organization like that providing the funds. But in the budget, we also have the funds allocated for that, because it's the social request that we will fulfill. So we hope that this organization that has experience in this area will also participate and help. Thus, all the services are aimed at reducing stress, for the person to be stress resilient in general, and confident about the day tomorrow and the future, because every person has to feel that the state cares following the state guarantees, but every state has to take care of every citizen, implementing the new development programs and the services which are being implemented. Thank you for your attention. Glory to Ukraine. Thank you that you paid attention to the possibilities and opportunities. Our legislation does not oblige every community to create a communal enterprise or organization. It's not always necessary. There is a way out to place the order, engage the service provider, and to provide the services to people who need that service. So thank you so much for paying attention to these mechanisms. A lot of new services that we speak over and over again, like the emphasis on psychosocial support and new skills which our social workers have to gain, all of that requires from us to keep on improving and to have daily trainings and to improve our qualifications. According to all our services, we do not let the specialists provide the services, even with the certificates, until they finish the necessary trainings and until they learn the script that the service have to be provided following. Because it's important for the service to be provided the same way, so that everyone would understand the standards and to know the elements of different services and to be able to work with it in a quality way. There is nothing worse than if the non-specialist starts working with the soul of the person. It can do harm, and related to that, there is a huge request to our educational institutions. We've activated our work with them, and we strongly rely on them in short-term courses, because yes, there is basic education, but we need to rapidly change the approaches and implement the new elements, and we need to rapidly introduce new tools. And now I'm glad to introduce Oksana Boyko, representing Kyiv Mohyla Academy. And over there, they have very powerful social work direction. We cooperate with them. So please, Oksana, tell us, how do you see the improvement of this area and the challenges we need to respond? Thank you, Oksana. Yes, I represent the department named the School of Social Work, named after Volodymyr Poltavets of the National University Kyiv Mohyla Academy, and this is the first and the oldest school in Ukraine that the education and preparation of social workers started from almost or more than 30 years ago. I always like saying that the ideologists and those who implemented the first projects on this profession and education in Ukraine, they were two psychiatrists and a clinical social worker. I know it may surprise you, but it is Volodymyr Poltavets, a psychiatrist, and Guzman. You know Mr. Guzman. For a long time he was the head of the Association of Psychiatrists of Ukraine and the clinical social worker, the professor of Cambridge University that spoke and raised the issue that it's really an important point to have this profession in the health sector and in mental health sector. So I want to tell you that it is so nice to see how the role of social work increases in mental health area in Ukraine. First of all, unfortunately, due to the war and due to the full-scale invasion and full-scale war, if we go back to the definition of resilience, the social work, first of all, is aimed at building resilience, supporting resilience, both human resilience, family resilience, community resilience, system resilience. So resilience, first of all, is about resources. It's not just about coping strategies and our resources that we have inside of us and the ability to use them. Resilience is about the availability of the resources we have in the communities, whether they are available, not available, whether they meet the requests of people living in the community. And only then a person in any emergency and even emergency related to the war can be more resilient and recover faster after any traumatizing event. Now about the university's role, especially in the times of war. In peaceful life, it's always just like in the war. This is the third mission of the university. The third mission of the university is the work with the people around, with the environment that is contributing the best that the scholars, educators, practitioners, scientists compile into one database. This is the contribution into the ecosystem we all live in, and in the times of war, the university's mission is to support and foster building this ecosystem of programs and services of mental health in Ukraine. Now, an example of our university, and in particular, our Department of Social Work that I'm proud to be the head of, and I am the alumna. I am the Doctor of Social Work and a PhD of Social Work. All our lecturers, they are practitioners. They work in different programs, NGOs, international projects. They always keep track of what's the biggest relevant need, what we need to pay attention to when we prepare the specialists, the future specialists who will become practitioners tomorrow, who already practice today in different organizations, including resilience centers. So such examples, for example, of such courses which recently appeared is the social work in mental health area, a separate course, military social work, countering human trafficking, separate blocks. You've seen MH gap, you've seen in the statistics data that was here on the screen, there are so many social workers who took MH gap and other trainings. It's important because social workers are the gatekeepers of the services of mental health. They are those who every single day can see who needs help. They are those who see the strengths of people, but at the same time they can see who needs to strengthen the strengths, to whom the person can be referred, and not only to whom, but they know how to create the service, lobby, and support it on the local level, and I address all the participants here. So one more important university's mission is to help promote, translate, interpret the results of the researches for the politicians, so that politicians would be able to make the right decisions necessary for their citizens. So my little experience, I can see I'm running out of time. I keep track of time. So my experience over the last year with the support of the How Are You program and together with the Mental Health Center Coordination Center for Mental Health of the Cabinet of Ministers, we went almost to all the communities of Ukraine, and the feedback about the motivating workshop about resilience of communities. After the workshop in one of the communities, the head of the Department of Social Policy came to me and told me, Mrs. Oksana, thank you so much that with all the heads of all the sectors in this area on the level of community, you keep on speaking and bringing up about the importance of social work. This is the priority right now, the understanding of social work in all the possible services of mental health. What the social workers can do about their capacity, potential that is underused in our country, and what impact they have on mental health improvement in the areas where they live and work. And lastly, I want to bring up one point. We are interested in the fact that young graduates have to go to the state social services, those which are funded by the state. And I would really appreciate if the employment policy pays attention to the payment for these services, because there are a lot of active graduates who know what to do. They have fully built professional toolbox, and they can come and help build this ecosystem. Thank you. Thank you. Really, to sum up, we can say for sure that unfortunately, for now, paying for these services is the weak area of the social area, but we work hard so that the payment would be disconnected from one tariff network, which by essence reduces the salary, because where we procure the service, where we see the total value of it, we do not use the tariff network. So first of all, I recommend communities to shift to communal non-profit enterprises. This way you can pay higher salaries. And secondly, we will keep on working, just like in the system of health, to level up the salaries and to level it up and make it competitive with other sectors. So what else do I want to attract your attention to? Social support is an important aspect and point and element of mental health. In the hospitals as well, if the person doesn't know what is waiting for that person at home, whether the house is equipped or not equipped, how after the hospital the person can take care of himself or herself, that person would not recover by 100%, because these worrying thoughts will stagnate confidence and taking steps forward. So, first of all, we need to provide full sufficient information about what's provided, but neither the doctor nor the nurse can do that. It's not their responsibility. So for us, it's really important that the social worker, whose responsibility it is to be in all the areas of life where the person needs support. And I'm glad that over this year we've had so many new projects, and we enter with the patronage service into the hospitals, into the military departments, which rehabilitate the people and military service members, and I hope that will improve the support for our service members so that they would understand what guarantees they have, what is the rehabilitation process about, what support we can provide, and this way we would take some load off the doctor's shoulders. Secondly, social support. This is the service of family recovery, family relationship recovery for veterans and their families. So this service has been successfully tested, including in Poltava Oblast. It's important. So communities do not simply transfer money to people. Give them a chance to use this service, and maybe for the first time in their lives they'll be able to speak about their relationships. That's important. And also not to take a lot of your time, because you're coming closer to me. I can feel that. Like, please keep an eye on the innovations and something that we will implement next year. We have a lot of initiatives that will help our people have a better life, to make our services more effective, accessible, affordable, because as it's been said, it's important to recover our people from different sides, because if the person is restored, recovered, then the person can keep on building and creating. Thank you, Oksana. I want to thank everyone here. Please stay on the stage after the discussion. Traditionally, we want to award you. Oksana Zbitneva is rushing onto the stage. So we have two Oksanas who will award people. So, social policy award. So, how are you? Award goes to Cherkasy Oblast. So, Natalia Kravchenko, Deputy Head of Oblast Military Administration. So, hundreds of thousands of IDPs crossed Cherkasy region. Many families stayed there and found shelter in the How Are You region implementation. 12 resilience centers work, 34 veteran spaces were created, or veteran hubs, and by the end of the year such spaces hubs will be in every community. In 37 communities there are 56 new positions of psychologists. 66 communities had the trainings on how to interact with veterans for the first responders. Please applaud. Then one more award goes to Rivnenska Oblast, Deputy Head of Oblast Military Administration, Lyudmila Shapkovska. Not to wait, but implement everything rapidly, to use all the possibilities, and services need to be created where they are needed most. This is the approach of Rivnenska Oblast, implementing How Are You program. In 64 communities, the psychosocial services are provided. 1,175 health workers finished MH gap training, and this system is aimed at people, because psychosocial service is functioning when it's close to people. Bravo. Thank you. How Are You award goes to Makarivska City Territorial Community of Kyivska Oblast, Vadim Tokar, the head of the community. Makarivska community back in 2022 was under temporary occupation and went under significant destruction. More than 40% of all the buildings and infrastructure was destroyed. Makarivska community is the benchmark of recovery and resilience. They don't simply rebuild accommodations and buildings and kindergartens, but they develop psychosocial support for affected people and IDPs who found shelter in that community. Thank you. How Are You award goes to Vinnytsia Regional Center for Social Services. Olena Stoyalova, the head of the center, please come here to get the award. More than 200 workshops, supervisions for specialists of social work, psychologists of social area, and non-formal unions of psychologists who provide support to the residents of the region. Vinnytsky Oblast Center for Social Services supports that, and the center also provides social services of adaptation for veterans and their families. That's a unique service aimed at strengthening family relationship. Bravo. And How Are You award goes to the Resilience Center of Mikhailo Kotsubinska Territorial Community of Chernihivska Oblast. Please come onto the stage. Larisa Zagriva, the head of the center. Mikhailo Kotsubinska Territorial Community was one of the first one in Chernihivsky region which implemented comprehensive service on building resilience. It had experience occupation, and it transfers it into resilience, and the University of the Third Age works there, and the Club of Kind Hearts works there as well. How Are You award goes to NGO Kolishchata from Myrgorod, Poltavska Oblast. We invite Tetiana Usik, the head of the organization. Kolishchata NGO supports defenders implementing the social family recovery project and adaptation of veterans. It raises awareness and engagement of citizens into decision-making process. It works on the conscious consumption and energy safety. The organization appeared as a result of the friendship of 4 women initiating different things in their city. How Are You award goes to the partner of social policy, UNDP, the head of the group of projects UNDP on democratic governance, Olena Ursu. UNDP program is the partner of the Ministry of Social Policy in humanitarian technical support and service support and locations. Thank you. Now, how are you? Is a word in the partner of social policy, Agro Holding Astarta, Svetlana Mozgova, the head of the Human Resources Cooperative Partnership and Communications of Astarta. Astarta is the strategic partner of Resilience Program, provides methodological expert aid, and creates the identity of the program, trains specialists, and so on. Astarta shows that strategic support of projects with long-term result is the investment for the future, and the Resilience Program is a part of the philosophy of agrarian holding and the projects of social partnership implemented in the communities. Thank you. And of course, the certificates are provided to all the participants. Please applaud. And I invite everyone to come here to stand beautifully, to take a picture, to commemorate this ceremonial moment. Of course, let's applaud to all of that continuously, because we need to thank. And in this case, we applaud to thank those who daily make our lives better. Thank you. So you can see how many photographers are working hard to commemorate this moment. Please smile for the camera. Thank you. Thanks. So please take your seats. In a moment, well, of course, thank you. So in a moment, we will continue. And we continue following our agenda. Ahead of us, there is a lot of important, and we have to hear and see everything. So probably we can say that it's just in Ukraine there is the ministry that at first sight is not very relevant to the topic of mental health, but it shows the data which really impresses. I have no idea what will happen right now. We agreed that there will be no reporting, but I think that we need to show you these numbers, because I'm not just saying that these numbers are impressive. The Ministry of Internal Affairs, that is the National Guards and the Border Guard Services, National Police, and the State Emergency Service. You can see the enormous volume of work they are fulfilling right now, and it's heroic deeds. Of course, they will tell you that it's just the work we're doing, and they are right, of course, but on the other hand, it deserves our admiration and respect. So briefly about the work with the personnel, they organized the system of psychological support and the work of the first responders. So all of you want to hear that, so we'll hear that from the Deputy Minister of Internal Affairs, Katerina Pavlichenko. The floor is yours.
Так, це ваш, пані Оксана, ні? Да.
Доброго дня всім.
Hello, everyone. So, the topic of our discussion is safety. Here, first of all, we have to say that safety doesn't exist on its own. This is the environment which is being created by many factors. The war brought a lot of tragedies into the lives of almost basically every Ukrainian. When we speak about the safety elements and security elements, first of all, we speak about people who, despite their worries, ensure calmness for everybody else. National Police, State Emergency Service. As it's been said by Timur, they are those who respond first in the emergencies. They register military crimes and war crimes. They rescue people from under the rebels and provide emergency care. And in the emergencies, psychologists of the National Police and State Emergency Service work. They provide emergency psychological care and aid. Our specialists know for sure what needs to be done in this situation, because they use the algorithm that was elaborated by us, within all Ukrainian mental health program. How are you? So this is the algorithm of emergency psychological care to the affected people, and these instructions, they keep on being improved, updated, taken into account the experience we gain and the new challenges we face. But today, first of all, I want to focus on our people, military service members and the workers of the big system of the Ministry of Internal Affairs of Ukraine. The divisions which have been listed, police, guards, border guard service, rescuers, that's hundreds of thousands of people who every single day face different challenges related to the armed aggression and who defend the country and our communities. There are different forms of that. They have different uniforms, but they have one objective: help, defend. And it's important that in these tough times, behind the uniform, you have to be able to see the person, first of all, who also gets tired, who gets injured and needs support. So the task of our Ministry of Internal Affairs is to provide the personnel with quality care and recovery. And in this direction, the efficacy of work and the quality of fulfillment of tasks depends on that. Especially we're speaking about people who serve in the military area or in the pre-frontline area, where the enemy's shelling doesn't quiet down, where the work is done 24/7. It's important to provide them with the necessary support and recovery. It makes sense that psychological mental health resilience is directly related to the motivation and desire to work. We develop psychological service of the Ministry of Internal Affairs and medicine, and we increase the qualification of our specialists. So when we speak about the relatively quiet life in the logistics areas, it's important to keep in mind that behind all of that, there are people creating that safe space. In this context, in this regard, we have to speak about the full spectrum of aid: psychosocial, medical support, and rehabilitation. In general, in the system of Ministry of Internal Affairs, mental health services are provided by more than 1,000 psychologists, psychotherapists, and about 100 psychiatrists. The psychologists of structural divisions constantly support the affected people on all the stages of service, treatment, and rehabilitation. Separately, we selected by the system of the Ministry of Internal Affairs the psychologists who've actually become the mentors of mental health, and we've named them mental health tutors. Right now, there are about 250 of them. They provide high-quality specialized care to the workers of the Ministry of Internal Affairs, and not only to them, but their families as well. Within this project of mental health tutor, we raise the professional qualification of psychologists in the system of Ministry of Internal Affairs. We increase their skills on working with trauma, and we create the community aimed at improving mental health condition of our staff in the system of Ministry of Internal Affairs. One more project that I want to briefly tell you about is the point of psychological practices. It contains a lot of different activities, and it's aimed at supporting our defenders. In this case, the Union of Specialists has one tool, unified tool for recovery, that has proved to be effective and has shown effective results. The psychologists of National Guards, Police, Border Guard Service, State Emergency Service, they go out on the visits and share the best practices, help in combat stress, and which significantly improve well-being. So, the point of psychological practices is being implemented in 20 regions of our country, and this year it covered more than 1,000 workers of the system of Ministry of Internal Affairs. And the workers in these points systematically work with our specialists, with the affected people in the medical rehabilitation centers and the hospitals, combining the treatment and recovery of physical and mental health. Rehabilitation centers of Ministry of Internal Affairs, that's the next level of recovery of mental health. In the system of the ministry, in general, we have 6 rehabilitation centers like that, and there is medical psychological rehabilitation provided there, and the capacity is more than 1,100 beds. At each given opportunity, when we meet with our international partners, colleagues, we attract their attention to the effort building the capacity of this specialized care. And thanks to our contacts, the specialists of the ministry right now have the trainings and qualification improvement courses, which are so necessary and important for us in terms of experience exchange with our international partners. We'll continue providing the trainings to our specialists because we understand that our specialists are the key to the health of both military service members and the staff of the Ministry of Internal Affairs. Always, and also we're implementing the project, the Center for Mental Health, for 120 beds. It is the core of assistance to the service members of the National Guards and State Border Guard Service. And right now the center is functioning for 80 beds as of now. And also the multidisciplinary teams work there, which were mentioned today in previous speeches.
The important task is to select and train the personnel. The quality assistance depends on the specialist. That is why, based on the major hospital of the Internal Affairs, there is a psychiatric department of the Bohumolets National Medical University. Now around 40 students are being trained. They are going through practical experience at this hospital, and there will be 20 residents which will also go through this experience. I would like to emphasize that we do not only work with the consequences. Our psychologists also work with the service members who are prepared to fight in the war. They are priming people to understand what they can face at the front line. That is why the Ministry of Internal Affairs is trying to provide a comprehensive set of psychological services from the moment the people are accepted for service to combating the consequences of the combat trauma and recovery. The main goal of the Ministry of Internal Affairs is to restore our employees and retain them. Another important initiative which I cannot avoid, which is very kind of in high demand, the campaign Be Your Own Friend. This is an information campaign which is the part of the All Ukrainian Mental Health Program, which deals with the stigmatization when people seek support for mental health support, especially among women. Traditionally, bravery in our society is associated with the absence of emotional services. This is a stereotype which has to be broken, which is ensured by this campaign, Be Your Own Friend, because very often men, they hush up their difficulties and do not seek support from psychologists. It is very important to understand that recovery of our country will start from everyone, and we have to take care of our mental health the same way we do about our physical health. Human resources potential is more important than infrastructure. Thank you very much for your attention. Thank you, dear Katerino. Please stay in the stage. Oksana, join us, because we will not break our tradition. And now we are proceeding with awards. The award, How Are You, goes to the Chernihiv region, and we are asking Zhana Sherstyuk, the deputy regional head. The Chernihiv region has a lot of cooperation with the different law enforcement bodies, with the police force, with the rescuers, with the probation center, with all the different law enforcement institutions taking part in the All Ukrainian Mental Health Program. They engage into the mental health culture. Your applause. An award, How Are You, goes to Shostkivska territorial community in the Sumy region. We are asking the deputy regional head, Vitaly receive an award. This territory is a frontline border area. The police force has been conducting a lot of measures, events for families living there, and they have provided over 500 mental health consultations. They also engage in peer-to-peer approach consultations, and the police force joins all the mental health events. Let's applaud them. We, of course, will transfer this award. If there is someone from this community, maybe a coordinator from the region, maybe you can take this award and then give it to your administrations. Then the applause for you. Congratulations. Please give our applause to the winners. An award, how are you, goes to the Emergency Service Department from the Poltava region. The psychological readiness and resistance of the rescuers are very important. Within the program, all the personnel of the emergency services does not only go through education, but also teaches others how to take care of themselves. Psychological support was provided to over 400 residents of the region affected by the emergencies. Thank you very much. An award goes to the sector of combating domestic violence to the Zhytomyr Police Department. We are giving the award to the current director, Maria Zub. She is responsible for the main department of the police in the Zhytomyr region. The personnel of the sector, they respond to domestic violence cases every day. They have different skills on how to provide legal, psychological, medical support. The All Ukrainian Mental Health Program inspired the sector to better the mental health of their workers. Your applause. An award also goes to the Partnership Foundation. The Partnership for Strong Ukraine Foundation supports the work of the Ministry of Internal Affairs, and they also supported the initiative Be Your Own Friend, which is dedicated to combating stigmatization among men. And now let's take a joint photo. Everyone come closer to capture this moment, and then so that it goes down the history. Of course, certificates. And let's applaud them. Thank you very much. Our congratulations and thank you for your work. All right, we will carry on. We are running a marathon, and to know how to take care of our mental health, to combat stigma and seek support is a basis for everyone. We need to create recovery points in all the departments. There are positive practices, there are different materials. All of this is about non-obvious services. For example, this mental health care at the workplace as a part of corporate culture. It can be very beneficial for all the workers, not to mention the fact that it is also about higher performance. According to the survey, to the research, physical activity is more effective compared to antidepressants. That is why active parks, different sport clubs, dances, Nordic walking groups, and other activities are a very powerful tool to address mental health issues. We have already touched upon this topic, but everything is overlapping, and the potential of different arts like singing, drawing, work with the wood, with different materials. People who are engaged in the arts are as twice as satisfied with their life. That is why we are talking about the activation of cultural institutions and free legal support, about youth centers and other opportunities which are numerous. Now we will talk about it in order to raise the awareness and highlight what we have and what we still lack. So that's why I'm giving the floor to the speakers of the next panel. Georgi Pachkuria, the director of the Kyiv Theater Malanka, which opened our today's forum. Petro Avramenko, the director of the Zhytomyr Academic Musical and Theater, named after Ivan Kochergan. The esteemed artist of Ukraine, Valentina Vitos, the director of the Altesky Cultural Center. Valentina Zhivatovska, the director of the Kirovograd National Library, the city of Kropyvnytsky. And let's applaud Evgeny Antonyuk, the responsible for the cultural activities in the Irpin City Council. And we also want to talk about these non-formal services in an informal way. And the host will be Oksana Zbitneva. Dear Oksana, I'm sure that you are aware of the time limitations. Now you have 15 minutes, and let's applaud everyone. Thank you. Today I have great speakers. I would like them not to be worried because they have what to say, so that they speak out of their heart, of their soul, and not from the paper, because the world that can be opened up by these speakers, it can be the world that you haven't seen yet. In fact, recently, Svetlana Royce, if you are here, I can see you. I saw you somewhere in the hall. So I saw one important, very important phrase. I was pondering over it for quite a while. The way from the trauma prison is paved by words. We need to be full of words, and a trauma also necessitates a listener. The trauma has to leave a person. That is why a person needs a hearing ear, or this has to be reflected or through the art. For this, we need to have certain conditions, certain spaces. Maybe you have been seeing to what extent the theaters are overcrowded because people are striving for something living where they will be able to feel the emotions, to cry out when singing or dancing. They will find what will help them unburden themselves. Today we will talk about the fact that cultural facilities are the resources for communities, so as to the residents of your communities have the space for unburdening themselves and making themselves resourceful again through arts, through potential which is brought by living arts. And my first question to Gia: I know your story I will not retaliate because you will share it with us later, but the Theater Malanka opens the second forum. These performances have been different. What did change during this year? What happened to you, and how did you perceive the participation in this forum? Thank you. My warmest greetings, dear friend. It has been an honor to be here to represent the different powerful theaters, to be a small component. In order to answer this question, I will ask you follow one story, because my personal story is closely linked to the answers to the questions you just asked. My name is Gio Pachkoria. I'm the Ukrainian director of Georgian origin, born in Luhansk. I was learning the Ukrainian and Russian languages since I was 5 or 6 years old. I was studying to be an actor. I could have never thought. It is very touching that being an adult, I will work under occupation during 2014 up to 2018. We were staging our performances in Ukrainian, under occupation, under Russian occupation. I was sitting and I thought to myself that I perfected my Ukrainian under the occupation when we were staging performances in the theater. When you're living in the Russian-speaking environment, you speak Russian, of course, but this theater gave me an opportunity to speak Ukrainian. And after I moved to Kyiv, I started teaching, training people. I trained more than 5,000 professionals, and on the 17th of December 2022 I announced the birth of the Kyiv Theater Malanka, and we are spreading the Ukrainian literature, arts in our modern vision, because I understood that I had a different vision about the Ukrainian literature, because we are used to the fact that usually it is about villagers, about poverty, about sadness, but we looked at it at a different light. I asked people to join me, and a lot of people, they agreed. I also had a performance which is called The Stolen Happiness, and this performance in April 2022 was staged abroad, and more than 35 times this performance was representing Ukrainian culture abroad, in the USA, in Germany, and in many other countries. We were showing this performance to the people who were forced to flee the country, and we saw so much tears, so much smiles. I didn't go there on my own. My actresses went there. I was supporting them, and we received tremendous feedback. You know, today at 7 p.m. we have another performance, and it is sold out. It means that people need theater. Theater brings them support. I know it as no one else. My mom is a refugee from Abkhazia. In 2008, I faced the war in Georgia. It does not prevent me from spreading the Ukrainian culture among the Ukrainian people, among people abroad, because a theater is a place where you can receive the responses to the questions you didn't even ask. The most important thing for me is that after any performance of any theater, you have this desire to act, to ask each other whether you like the performance or not. For example, someone might say, I was so impressed by that performance. I was so surprised and stunned. You must go and see it. So I think that theater helps us resurrect that big cultural foundation and show all the country, Ukraine, the world, that Ukraine is alive. We have our own culture, our own art, and we smiling despite our pain and developing our arts. Sometimes, yes, this performance lasts for 5 minutes, but I have this feedback inside me. I am very grateful to you because the performance is not born here or there, it is born when we are together. Thank you, Gia. Can you tell us, please, what is the name of the actor who was playing the main character? Her name is Maria, and last year she was also the main character. This year she is 8 months pregnant. I asked her whether she agreed, and she said, of course, I will play. To be honest, it seems that for those brave women who give birth during the war, we need to applaud them, and even standing, because during the wartime they give birth to children. Natalia Zabolotna, if you are here with us, this is also for you. This is the biggest manifestation of resilience and optimism. The theater can work wonders. When we were talking with Petro in advance, he said one thing, that during the war, people have a flow of creativity. They create performances even better than created by playwrights. But the theater is a platform which can combine different experiences. Different experiences is what we will live with. So, dear Petra, can you tell us about your wonderful project? Hello. In fact, we will talk about the project Women's Dignity. Women IDPs and military women, they took part in this project because they were combined by terrible pain. But at the same time, they were separated. Let's be honest today. Then we thought how we could measure that pain. One woman says, my husband was killed. The other says that her husband is in Russian captivity, and who is in more pain? We cannot compare that, but they have the different vision. And back then we faced a dilemma. How could we work with them? So we decided to take a theater as a basis because we can put people in different conditions. The most important thing is not to go overboard. It is not necessary to watch tragedy after a comedy. When we first met them, we understood that they were unable to spill out their pain because they became reserved and they couldn't do anything. That is why we suggested that they improvise. We asked them to write their thoughts on a piece of paper. What they wrote was really wonderful. I thought that some things were written by a playwright, but in fact it was written by a woman who has never written any performances. We combined all these stories into one. As they are constantly in conflict, we said that according to the director's idea, you will not tell your story. We will play this performance, but we will divide the text. During the rehearsals, they started reliving through other people's lives and gradually understand that the pain can be very strong in both cases. The rehearsals were just terrible. They were so hurtful. People were crying. We couldn't show our tears or emotions, but it was so difficult not to. We told them that it was not only about theater trainings. We said that it would be a full performance that was driving them from their reality to our reality. They knew that there will be a performance with professional directors, that there are professionals. Everything is serious, and they manage to distract themselves from their pain for some time. That is a great performance. I highly recommend it. If it weren't our performance, I would recommend myself to watch it. There is another thing. The women, they had a photo shoot, a simple photo shoot, but what did it bring them? Maybe they have put on the proper makeup for the first time. They felt themselves feminine, and that pain not only united or separated them, it gave them an opportunity to come together. They have a Telegram channel. There are constantly messages. We are chatting about the project. This is really works in our lives. So, Petro, we are inviting you to Zhytomyr. Please stage your performance next time at our forum. Please rehearse, and you will stage your performance at the next forum. The regional coordinators and our center visit different corners of Ukraine in order to see the way services are provided in different regions, because by doing this we can see something useful, something that we didn't pay attention to, and feel pride. When we were in Kropyvnytsky, when we saw the library, which became a true, real hub for children, for parents, they also have art therapy there, different interaction spaces. They conduct mental health trainings. All the coordinators promised to create the same thing in their regions. Now I'm giving the floor to Valentina. Can you tell us, please, how did you come up with the idea? How did you regain your inner strengths to bring back vitality to your library? Thank you very much for having us. You know, we are worried with my colleagues because when you are doing your job, you are just working and helping people. But when you want to tell about this, you are constantly nervous about missing something or not having enough time. Maybe we will get off on a tangent. You know, libraries, they have been existing for a long time, and we are fighting for our survival so that we are benefiting our residents. Before we said that we would provide information for our residents. Maybe people need a book or a journal. We also had trainings on digital literacy, digital governance, but then the war broke out. Our library in Kropyvnytsky is a regional universal library, the main library in the region, having a lot of funds. The historical center for many libraries in our region. We understand that today we need a different kind of information. We were working on the second day of the full-scale invasion. We were coming to people online about what they have to do in order to preserve their health, how to act if there is an attack, a strike, about the types of strikes, so I mean military strikes. On the third day, we had our phone, wired phone, which didn't work for 2 years, and one of our readers called and asked whether we were open or not. Of course, yes. Libraries are public, open facilities. Even during lockdowns, without electricity, libraries were open and provided their services to a small number of people. Today, our library is very accessible.
So a day we have from 100 to 500 visits from our users. And the first days we understood that we're the central region and a lot of people cross our region, and these people need information on where to go, where they can stay for a night, or where to eat, where to go. Then we understood that people who stop in Kropivnitsky in our region, they have to receive psychological, psychosocial support. So we went into the places where they stopped. We tried to become friends and partners for them. We invited them to the library, and we started from, the usual workshops and all the way up to the fact that thanks to the support of local authorities and international foundations, as of today, we have powerful spaces for families with children, spaces for children, child-friendly spaces. We have the parents' clubs, and we've created that not only in our library, but also in 25 public libraries in the territorial communities. It goes without saying that we're grateful both to the Charity Child Foundation of the UN, UNICEF, and we're thankful to our charity foundation, Safe Future, Goethe Institute, and the International Foundation 2WO, and a lot of other institutions, organizations helping these services to be comfortable. We understood that we can not just provide the services and become the psychological hubs for the families with children, because within the project everything started working taken easier because we managed to ensure the work of the psychologists. I mean, psychologists worked both with children and their families. We understood that we have a lot of children to work with, and not thanks to, but due to the fact that there is this military aggression and conflict, and children have speech problems. We have the speech teacher working with them, crisis psychologists working with families with losses. So we have parenting clubs where we train and speak about how to survive these days. We ask people, how are you? What knowledge people need to feel calm and harmonious, and so that the person could help both himself, herself, family, and children. Valentina, thank you. Let me also comment just a second and you'll applaud. So I can say that in the library we had to conduct the training in one of the rooms, but we were kicked out of there because exactly at that time, on Saturday, there was a session for the elderly people. Just the movie was showing for the elderly people. Take advantage of that. These are the little life hacks, the little ones that don't require a lot of investment, financial investment. These are the services which can help your people in the communities. Now applaud. Thank you. I will ask Valentina to take the microphone. So you represent Odessa region, and you have your own story, which is very moving, but you've managed to transfer it into growth and to make it into an active action and energy that you use to charge all the community of Odessa. Please share. Thank you for the opportunity. About 10 years ago, I wanted for someone to ask me, how are you? Because I lived in a family. My husband is a military service member. He was the person who received disability in the war. My daughter was a teenager, and, in my family, I had two people with exacerbated feeling of fairness. One had the teenager maximalism. The other one, my husband, had a trauma of war. And from that moment, for a long, long time, I worked so hard on this problem. I learned, studied it. I finished a few workshops. So I have a few certificates. I learned art therapy. And all of that these days, well, not even these days, from 2014, it started when IDPs, internally displaced persons, came to Odessa, mostly from Luhansk and Odessa oblasts, and we started thinking, so how can we engage all these people who left their homes, who probably were artists there, or maybe folk artists, dancers. So they just left everything and went into the unknown, into the strange land they know no one in. So it was so difficult for us, and we tried to find these people, and we keep on searching among those who appear in Odessa region. And our all-Ukrainian mental health program in Odessa Oblast, Odessa region, we can't imagine without an IDP from Donbass, Svetlana Kucherenko. Maybe our community of the folk artists of Odessa and the specialists of embroidery cannot imagine its life without Inna Maybutska from Kherson. And during the occupation, she embroidered 4 shirts and evacuated them together with her family. So we cannot imagine our life in Odessa without the vocal ensemble of folk song named The Dream from Mariupol. And when we say that the assembly from Mariupol is on the stage, people ask questions like, yes, the head is from Mariupol, and the 3 singers, 3 members of the orchestra worked there for decades. They got evacuated to Odessa region, and they took with them not some valuable things. They took their costumes they use on the stage, and these days they perform on them. Yes, there are only 3 members of their team, but the IDPs from Kherson joined them, and IDPs from other regions joined them, and our citizens from Odessa joined. But we announced that this is the ensemble from Mariupol. So 10 years of war and 10 years of different tough experiences, all our actions, all our results we gain from our experience. When we want to have the exhibition of decorative art or like any type of art, we ask the question, will it be interesting for people who come, for our visitors? For example, we aim at the audience going through the rehabilitation in the medical centers, in the hospitals of Odessa, and we think, will it be interesting for them? And let me give you an example. In the Philharmonic, there was a huge concert conducted, and from the hospital they brought 20 people. Some of them were on crutches, and like the ambulances brought these people there. So when the concert started, and in the hall there was this exhibition of paintings, and next to the painting, when everyone entered, there was one injured man standing next to the painting. He looked decently, but he was standing and crying. And there is a concert in the main hall, and in the other hall he's just standing and crying. We're not psychologists, we didn't know what to do. But then he says, I came to that painting and I felt it's mine, as if I was at my mom's backyard. So of course we presented him this painting, and he said that the flowers painted there, he felt the smell of them, the aroma of them. We presented that painting, but we understood that all these things matter. So we gathered the artists, we collected their paintings, and we gave them to our military hospital, and we organized the art gallery there. Then we started organizing mobile exhibitions, which we even provided to the front line, to the units we stay in touch with. So we have a lot of such things, and all of that comes during the process of cooperation. We organize a lot of concerts, we get invited, and let me highlight that we get invited into the rehabilitation centers, not treatment centers, rehabilitation centers. We go to treatment centers, health facilities only if we are asked to do that. Usually we go to rehabilitation centers. So the artist, the singer comes out, and from the 5th row, the guy shouts out, please wait, start again. Sorry, I couldn't get in touch with my compatriots because he's going through the treatment, and he decided to stream live with his compatriots. So we understand that all of that is important, is needed, and it may seem to us that yes, maybe it's not a bit of the treatment therapy, but we treat the soul of our people, and our means are the songs, the words, paintings, traditions. And I want to attract your attention to the fact, let me share my information about my center. In the territory of my center, we created the open interactive space for communication of different artisans and people, everyone who wants to craft and who's interested in our national folk culture. Valentina, I'm terribly sorry. We have in the room the heads of the communities and the deputy heads of oblast military administrations, regional coordinators, universities, businesses. You see, in 5 minutes, you can see how many awesome ideas you received, and probably you noted them so that you would implement all of them, because we have to craft that. We have to sing, dance. We have to use creativity to find the way to heal and rise. And this is not something that takes huge resources. It's just something that you need to be willing to do. Thank you, Valentina. If I may, just one final word. Just one word. So we created in this territory, in our center, children come, adults come, women come. So it's not just to develop their art skills. They communicate, meditate, and create something. They created this scarf. It's interesting, it's beautiful, it's a nice present, but also it can be sold, and 200, 300, 400 hryvnias can be donated or can be used for their family budget. I can say a lot, but Valentina, this is the fact that you want to say a lot. We get it, we all get it. Right now, it was the signal. There are so many heads of different organizations here, a lot of managers. So actually, this is the signal for you. Get your teams together and simply talk to people. Give them a chance and space to talk and be heard. This is the huge resource you can use. And keep in mind that you have to thank all of them. Thank you, Valentina. Evgenia is waiting for her turn to take the microphone. I know that she wants to share a lot with us, but just in case, I will interrupt you when the time is out. But Irpin, after occupation and the second day, the central square, there is an orchestra, right? So, the floor is yours, Evgenia. If we speak about mental health and culture, I think that the culture is that big potential. And it is a strong foundation. The life of each and every one of us starts from the lullaby, the fairy tale we hear from parents, and the well-illustrated book, and it's all about the culture. But these things are so felt when you can evaluate how worthy that is, because the city that is a hero, Irpin, which was occupied by 1/3, 2/3 was governmentally controlled, but 1/3 was occupied, and it was destroyed by 75%, and all the cultural institutions of the city were damaged to smaller or bigger extent. 2 institutions were fully devastated and destroyed because they were on the way of the occupants to the capital. So March 28, our city was liberated. It was 1 month in the occupation. And April 6, they allowed the civilians to go back into the city. Not all of them, just the heads who could bring benefits to the city. April 12, we were putting the film on the windows, which were cracked and damaged, and we thought how to open all these facilities because there was no electricity, there was no internet, there was no nothing. All the electrical wires were lying broken on the floor, and to buy something you needed to go to the capital, to Kiev, and if you lucked out and you didn't end up in the curfew, you could buy some food. But it's okay, we kept on working, we had people to work for. And there was a phone call. The head of the team of the military orchestra, Edelweiss, called me, and he said that we will go to one city and we want to come to Irpin with humanitarian aid. Can we do that? I said yes. But we have an interesting request, he said, and they asked to play in the central square in the city where 100,000 people lived before 24th of February and 6,000 in the moment of liberation, where there was no water, electricity, civilization. The request seemed weird, but why not? So when the orchestra played in the central square of the city of Irpin, From the neighboring houses, people started coming into the streets and crying. They were crying, hugging each other, and they understood that if in the hero city where there is nothing, where people are working on the basic things and the music is playing in the streets, obviously peace will come back into their city. And in 3 days, the artists came back into the city who wanted to depict the destroyed cities in their paintings, and people came out, communicated with them, and they could see this belief growing that Irpin will open up soon, will open the doors for all the inhabitants who want to come back. My mission is to share the story about the museum. So, museum. May the 1st. It's a bit more than a month after civilians returned into the city. The museum opened, people started showing interest and going there, and it motivated to organize in the museum the revitalization, because obviously we had to show this brief but very important page of our history, this heroic liberation, because Irpin was heroically liberated by our defenders. And back then we started working, and I found the possibility to contact the IOM, International Organization for Migration, that we worked with, applied for the grant. We engaged the local authorities. With joint effort, we revitalized that museum, and it became the absolutely new space. Absolutely new space. Now think, as of today in Irpin, there are 23,000 IDPs in the hero city, which was destroyed by 75%, in the city that is being rebuilt so rapidly, because if the state doesn't manage to do something, the city engaged the foundations and charity foundations help. And right now in Irpin we have 23,000 IDPs, and the city is being rebuilt. And when people, they equip their household, they go to the museum because they wonder what city they are in. They want to know, they want to have the information about the territory where they obviously will have to live for a while, or maybe some of them will stay for the whole life. So our museum right now is the multifunctional space. It's not just the place where you can look at the history. It's a modern place equipped with VR headsets, and we also have multimedia gallery room. And in this gallery room we have every 2 weeks new exhibitions. And first of all, we provide the opportunity to exhibit their exhibitions to veterans, photographers, IDPs. We take turns with paintings about wonders, about the spring, and the next exhibition is going to be about the war, because people who took these horrible pictures, they cannot live with them at home. They need to share all of that. So when we have the presentations, when people come, communicate, talk, and also there are a lot of activities in the museum for the widows who live right now with their children only, and there are workshops, and the museum is the place where people come and communicate. So we keep on working, developing, we invite people, we're waiting for you, we're ready to share experience. The city is a hero for a reason, because it's the city of heroes, about heroes. Welcome to Irpin. Thank you, Yevgenia. Thank you. And I do hope that something that you could hear from colleagues here during the panel, you'll be able to implement by the next forum, and you will brag about the results here during the next forum. Because only people make changes. Only people can implement and make such desires and aspirations true. And people get treated being around people. This is the fantastic power of our country, and you are a part of it. Thank you. Thank you so much for your discussion. You know, we don't even need to ask people to applaud. People applaud when everything is great. Thank you. Oksana, you're here on the stage. You don't need to come on the stage. So let's move on to awards. So, How Are You award goes to Zhytomyrska Oblast. We invite Alexander Fedka, Deputy Head of the Oblast Military Administration, For Zhytomyr region, mental health is about investing into human capital and regional economy via developing culture, youth and sports, regular trainings, physical activities, going to theaters, museums. That's all about relieving stress, improving life quality, strengthening self-esteem and social skills. In the region, active parks, the workshop of youth activities, hubs in the libraries, the psychoeducational activities for workers, youth, IDPs, veterans, women are organized. More than 3,000 activities were covering more than 80,000 people this year. How are you? Award goes to Zaporizhzhia City Territorial Community, so we invite Regina Harchenko, the head of the community. Zaporizhzhia has sheltered the residents of the region evacuating from occupation. Zaporizhzhia is an invincible city resembling resilience on the basis of invincibility hubs, the safe places of the city. There are activities dedicated to mental health, 8 days of co-action that engaged more than 2,000 people despite shelling and air raid sirens. The libraries have mental health component and educational facilities have mental health lessons. And in Zaporizhzhia, there is the Council of Barrier Free, which provide different services, mental health services as well for all people. Let's applaud. And How Are You? Award goes to Art Space and Playback Theater Station Uzh from the city of Uzhhorod, Transcarpathian region. Natalia Shevchenko, co-founder of the theater. Please join us here. The Transcarpathian region, together with How Are You, implements the project on the development of non-formal services of psychosocial support in 5 pilot communities. The groups for different activities are created, and psychosocial support and psychoeducation for youth is provided. Let's applaud. How Are You? Award goes to Terebobliansky Specialized College of Culture and Art, Ternopil Oblast, Olena Tkachuk, Deputy Head of the Director of the College, Culture, Healing Souls, Education, which makes culture. That's what they say about Terebobliansky Specialized College, which sheltered a lot of IDPs. Here, mental health activities and support is provided to people, and the hostel of the college sheltered 1,700 IDPs who received not only the shelter but psychological support. And from 2024, there is Safe Space, which organizes different activities and art therapeutic activities. So How Are You? Award goes to Kirovohrad Regional Universal Library, named after Chizhevsky, the city of Kropivnitsky. Valentina Zhivotovska, the head of the library, is here on the stage. And in this library, the real space of mental health is created, which is clear and comfortable for everyone. A regular school of crisis psychology happens here, where more than 100 psychologists finished the training, and the cooperation with international NGOs and NGOs on the development of psychological support for children and adults is happening in the library network of the region. The next award goes to the NGO Khmelnytsky Spellow Club Atlantida Khmelnytsky region. Andriy Sherbitsky, the board member. This club within How Are You program implements psychological and social rehabilitation for veterans, IDPs, children, teenagers, and the recovery follows unique methodology that has no analogs. Within a year, more than 9,000 people got rehabilitation programs. And also, How Are You? Award goes to the partner, the Red Cross in Ukraine, the Department of Rehabilitation and Support, Anna Didenko, and the Office of the Red Cross in Ukraine, apart from humanitarian component, has psychosocial services and provides a lot of the trainings and supports psychoneurological institutions. And of course, the certificates for all the participants of this cultural discussion. To your applause. So please come to the center of the stage for the family picture. Be brave, be brave. So I see that you're a bit tired, but we agreed that all these processes need applause. It's rehabilitation. Thank you. Thank you. Well, the only thing, Oksana, I will not let you go. I will not let you go because right now you will have the solo speech, if we can say so, because today, throughout the whole creative working day, because there was a lot of creativity in this event, we could see the pieces of the puzzle that the new area is built from. So we will see how the coordination of all the processes works, we can put all these pieces of puzzle together. So let's hear firsthand from you. In a moment, our stage will be prepared to look beautiful because we're all for the beauty of the shot. So everything has to be the way it has to be. So you can take your place and get used to this transparent post. So, in just a moment, Oksana Zbitneva, the head of the Coordination Center for Mental Health of the Cabinet of Ministers of Ukraine, will speak on the topic how the coordination of all these processes works. Thank you. I will look into the notes just to provide the summary of what was happening today, because just like the speakers who were on the stage, I want to speak a lot, but I need to be very concise to finish on time. First of all, I want to thank each region of Ukraine, each oblast. How Are You program is developing thanks to you. I sincerely thank you. Kherson, Sumy, Chernihiv, Zaporizhia, Kharkiv, Poltava, Vinnytsia, every single region. Thank you that you're standing strong. And thank you that you're working. And I also want to thank those who work in the area of mental health in each of the sectors. Thank you. Thank you that you invest your soul into it. Otherwise, without love, no program can grow. Thank you. And I ask the whole to support with applause. In this room, this community shows that they care to mental health and they fight for the wholeness of the nation, and it helped us to filter what's not necessary and focus on the most important points, on what's strengthening us and strengthening our pillars, and helps us keep going forward into the future. The person's condition has to be in the center, in the heart of the system, because as the First Lady rightly said, the ability of a specific person to listen to himself or herself and own experience, that's what's the basis of the resilient nation. And together we build the space that is aimed at building internal resources, daily coping with the challenges and moving in accordance with the values.
This is the desire to create such a mental health system that will correspond to the path Ukraine is going through right now, that stems from our communities, not somewhere in the hospital. This is the system which understands that mental health is also about the experience that we will gain during the war. Different experience, deep or shallow, the system has to be perceptive of that experience, adjusting these services to the needs of different targeted populations. That is why we are starting our discussion with the question, how are you? Because, for example, the previous system had a very limited lens of diagnosis, and we were moving from a person is healthy or has a disorder. People were labeled with different diagnoses, and others were just eradicated if they did not meet the criteria. I cannot say that before we talked about the mental health in order to cover all the components. The system as such did not exist. It is being created right now after with you, by you, under missiles, without waiting for the victory, because these are not the columns with limited borders. This is about different states and conditions that a person will live through during his or her life. So we have to take into consideration experience, as except for genetical predisposition, mental health disorders have their roots, especially it is obvious now when people lose their physical health, livelihoods, friends, families. Although the majority of us already learned to cope with the challenges, and the survey results also testify to the fact that it's important to take care of ourselves. We are starting to look for different responses based on our condition, the way we feel today. When we are talking about resilience, it is important to remember about the predominant emotion, which is fatigue. It means that we need to emphasize the skills which can make us resourceful. Tense emotions come second. That is why it is important to take care of yourself. I'm sure that in our further surveys, the results will be different. The responses will be different. During the first day of our forum, we already noticed the way the mental health system is integrated in different sectors. The ideas that were just some small pilots are now being scaled up to different services. So we need to combine different bricks to come up with something comprehensive. So we need a project to have a configuration. We already have this vision. We know what we are building for sure. The First Lady of Ukraine also mentioned that the all-Ukrainian mental health system has a targeted model system with the main priorities within every sector with their tasks and duties. This process of change is happening in the synergy with the scientists' research, which was presented in the Lancet journal. I am sincerely grateful to Ukrainian scientists and their colleagues from 11 countries who produced that incredibly important work. The main provisions of this commission are closely linked with the aspirations of our Ukraine. It is for the first time when we are moving into the legislation on mental health with new sectors, for example, like education, employment, emergency response, and others. There are new rules for cooperation and interaction. The system becomes interagency, intersectoral, and multidisciplinary. This is the essence of the draft law. We are grateful to our members of parliament who adopted that during the first reading. And tomorrow, by the way, we will work and perfect it. Today, we can see that we have achieved a lot. For example, we are providing comprehensive trainings. We create new occupations, starting from the sector of education to the sector of defense. And the voice of the First Lady made the mental health obvious, conspicuous, and fashionable. That is why the attention to these sectors is not only important, but is critically important, vital. thousands of new specialists are joining the system, and they are not mental health professionals. For example, family doctors, nurses, teachers, social workers, social educators are already able to provide psychosocial support. New solutions are brought through the lens of real data and analytics, and the stakeholders in Ukraine and abroad become the integral part of the interaction ecosystem. In this model, culture is a powerful tool of changes, and the state policy creates a new wide frame. Mental health in all sectors, in all policies. We can say that we have already crossed the first stage. Services do not exist anymore as separate supples, and different sectors, they combined their visions, and we can already see the future construction which will be able to respond to our challenges and provide for stability in the long run. If we compare it with a house, we only have the framework, the walls for fully operations. In order to fully operate, we need interaction. And then we have a question: what makes the system alive? It's about bringing different stakeholders together around this objective. The ecosystem was born out of necessity to respond accurately and very effectively in uncertainty. We were using the available tools back then. It required a new approach, how to provide the signal between different sectors, how to do so that best practices are scaled up and the feedback is not lost. We have this three-level system of coordination. The solutions which are born at the very top, they are given down to the communities, but this is about a two-way street which ensures the return of the valuable experience which is analyzed and integrated into our decisions. This allows for a system to be very flexible, adaptive, and functional. The coordinators of the All-Ukrainian Mental Health Program spread information, they exchange insights and experience. This is a community of professionals forming a clear vision of what the response to the needs have to be in the territories. We are completing this third level of coordination, meaning the consultants in the communities. They work in the hard-to-reach places. Their task is to create roadmaps and bring different service providers together in order to create the networks of support so that the service is as close as possible to the person. It needs to have very clear entry points. The task of coordinators, the deputy regional heads and other professionals is to identify these entry points and establish ties. These entry points are implemented in different sectors. For example, in healthcare, everything starts with the family doctor. For example, there is a psychosocial component added to the medical services. There are also multidisciplinary teams and specialized branch of support, specialized branch of support. This has to be the priority of our country for the next year, and we have what to do there, and we have a lot to achieve. In the social sector, there were created resilience centers. In education, mental health becomes an organic part of the learning process, and many more entry points. For example, in employment centers, in cultural facilities, we have already heard a lot of true stories from the community-based service providers. This service has to exist everywhere where a person comes to receive services. We come up with our own recipes when our baseline conditions are very different from ideal, and now we can already accumulate Ukrainian expertise. Excellent centers will become the spaces to represent our experience with the international communities and a platform to share experience among Ukrainian experts. We are planning to create 2 excellent centers next year. This is about discussion about mental health at the national level. If there is a kind of considerable stigma, communication became the key tool, covered a lot of community. When we are explaining the importance of mental health during the war, we brought the mental health from the medical context into our society, making it not only conspicuous but also fashionable. This dialogue was launched by the First Lady, then the recognizable brand How Are You was born, but the creation of the brand is not the main mission of our program. Communication is also very important at the same level with research or coordination, because communication sets the framework and allows for cultural mind shift. Explaining everything in plain words. When we started the communication company, we faced an acute need to create a service which will meet people's demands, because it is not fair to make a person think about their conditions without providing support. Then the response to this challenge was engaging the family doctor as new services emerged and mental health managed to get rid of costs of the Soviet era psychiatric care. Communication forms the facade of the new service, which is already familiar, but at the same time very professional and competent. When we are talking about the future path of our program, I would like to focus on our joint efforts. The service is not about an office or about a sign. This is about professionals. Our priority is preparation, reskilling and upskilling of the professionals. It is important to institute the code of ethics, the register of specialists, which will acknowledge and recognize the quality of work. Without this, our country risks losing the control over the quality of the services. The transition from the experimental approach to the evidence-based approach. So we need to take into consideration different evidence-based approaches, standards, in order to achieve better outcomes. The service has to be clearly defined and standardized in order to ensure quality and meet satisfaction. Multidisciplinarity and integrated services allow for communities to govern their financial and human resources, focus on the trauma-informed care in order to help people live with new experience and turn it into their inner resource. Community-based services have to be well-structured, evidence-based, and respond to the needs of the community, because small bricks, small steps, small decisions of separate people bring about a big transformation. And we should remember that we cannot make steps instead of the people, making them constant clients, users of our services, only investing into internal resources, taking a comprehensive approach. We need to help people to go through these ordeals or difficult times with their faith and belief. Small, separate stories, they bring about the description of our resilience. We are not the first generation to go through the storm. The philosophy of resilience was born due to a set of tragedies, the scale of which goes beyond the understanding, our understanding. But our generation strives not only for survival, but for thriving in our country. Please take care and preserve your mental health and resilience. Dear ladies and gentlemen, Oksana Zbitneva, thank you very much. You a stickler for time, and thank you very much for your work. And in order to finalize our first working session, we have another speech of one of our guests. Now I'm giving the floor to the expert of the WHO headquarters, the co-chair of the reference group on MHPSS in the Interagency Standing Committee, Fahmi Hanna.
Thank you so much. Thank you. What an amazing first day. Really remarkable first day. Congratulations to all the organizers and all the speakers. Really, thank you. Source of honor, source of inspiration to be here with you. I was asked and tasked with a difficult task. I thought it's easy in the beginning. I was tasked to link what we have heard to some of the international guidance and practice and standards. But it's not easy, because I think with what we saw today, you have raised the threshold of these international standards and guidance in Ukraine with what you're already doing. Talking about building back better is not easy, because there is no the back part, as we heard today from Oksana. This is happening while the war is ongoing. Against all challenges, in most difficult time, there is investment, and investment do work, and the world is seeing one of the largest scale mental health and psychosocial support scale up at time of war. Talking about person-centered, from the moment this meeting has started, we saw the focus on a person. The actress who was speaking about her experience. Throughout, I heard the person-centered several times. The meeting about resilience, where we are at, is a source of resilience and hope itself. The very fact that during war, in the middle of war, we are talking about building a system that would take care about well-being, not as a luxury, but as a right. We talked today also, several international speakers were admiring the fact that this meeting and this program, all of it is run by Ukrainians. The all-Ukrainian mental health program is definitely designed, run, and implemented by Ukrainians for Ukrainians. This is localization being implemented in practice as the world talk about it. But again, what localization? This has moved from being localization into globalization. What's happening here? Ukraine demonstrated at the World Health Assembly in this particular year, in May 2024, to other countries to adopt the same approach and integrate it for the first time in history of the World Health Organization to have a mental health and psychosocial support resolution. Many inspiring moments. Multisectorality. I've worked in this field for the last 2 decades. What I have seen today is so unique. I have seen several ministers talking about how they worked and approached with local and international partners their specific sector, from sector of health to sector of education to social solidarity to culture to Ministry of Interior, among others. Engagement of people with lived experience is key for the World Health Organization and many international actors. And today we saw that. But we saw it also through TRIAC campaign in general by people talking about their own experience. But we also saw it from the primary healthcare doctors, the GPs, who were talking, family physicians in the morning, who were talking about their mental health need together with the Minister of Health. That's quite unique. Talking about sustainability. Within the Interagency Standing Committee, you always say build on existing structures. Today we heard a lot of this. Everything is not created parallelly. Everything is building on people who are currently working within governmental and civil society institute, building on existing structure and ensures that the system is sustainable. I think the program is also a great model for decentralization. Not only I watched it today, but I got the opportunity of seeing many of the deputy mayors and seeing many of the coordinators in the field. I have visited several oblasts and several cities, including some on the front line this year. And thanks for Oksana and her team for facilitating these visits. I have seen deputy mayors talking about evidence-based practice and presenting statistics on tools such as image gap and psychological interventions in places very remote, away from Kiev, in clear decentralization and local governance and local scale-up of evidence-based packages. There are so many good things. I think we are going to publish many of these positive findings in a global report in the first quarter of next year, based on what we learned during the missions and also insights we are getting from you today. But also my good colleagues, Alisa and Oksana, asked me to present some recommendations, some suggestions. Again, it's not easy, because it's very difficult to give recommendation to something you see as brilliant and for others that need to learn from. And I think this is one of the key messages. Please remember that you need to document all what you're doing. What you're doing is unique at a scale that the world has not seen before, reached far and beyond what any other country in this situation. Please document and share it with others. The centers of excellence was amazing to hear about. I think this needs to be continued. Second recommendation for investors, for funders, for donors and partners who support Ukraine, please continue. Remember, the All Ukrainian Mental Health Program is nearly around 2.5 years old now. But the program is trying to overcome neglect that preceded it for decades in this area of work. There is no resilient mental health and psychosocial support systems that get built in 2 years. So let's not consider that we don't need to invest more. Actually, since we reached that level, we need to invest more to be able to achieve universal coverage in mental health and psychosocial support, to reach everyone. And make sure we are reaching groups which are usually difficult to reach in other countries, such as people affected by suicide. We have good suicide prevention program, people with substance use, people in institution, children, veterans. Make sure we have no blind spots since we are reaching this scale up. But we should not stop investment. This is the time actually to invest more and continue for the coming years. And for investors, remember, when you invest in Ukraine, it's great and needed and important for Ukraine, and there is a return on investment, but also you are investing in other countries because Ukraine became a role model for others. Thank you, and looking forward for day 2.
Fahmi Hanna.
Fahmi Hanna, thank you so much. Dear ladies and gentlemen, by this way, we are nearing the end of the first day of our forum. It seems to me, and please applaud if you agree with me, that today we managed to create a warm and creative atmosphere that we were striving for. We managed to highlight different moments that we need to better and we draw a lot of inspiration from each other, which was one of our main tasks today. I am very grateful to you for this day. Tomorrow we will have different sections. We will start at 10 o'clock, and now please let's not go home right away. There are a lot of traffic jams. Now we will have a delicious dinner so that you are able to talk to each other, share your ideas, insights that you might have gained. So enjoy your meal, and glory to Ukraine.